like to request everyone to please take your seats. Also, a very humble request, if we could put our mobiles on the silent or the vibration mode for some time to maintain the sanctity and decorum of this wonderful day that we're about to begin. Ladies and gentlemen, requesting everyone to please step inside, especially our delegates who are standing outside. We request you to please step inside the banquet and be seated. We're about to begin in the next few minutes, in the couple of minutes. अगले 5 मिनट में हम शुरू करेंगे. सभी से निवेदन है कि बाहर की तरफ जितने लोग खड़े हैं प्लीज़ बैठें और अपने मोबाइल्स को कुछ समय के लिए आप प्लीज़ साइलेंट पर रखें. बहुत बहुत आभार. A very wonderful, warm welcome to everyone who's joined us here today. Ladies and gentlemen, we should be beginning shortly. Thank you. Ladies and gentlemen, requesting everyone to please be seated. We are beginning. सभी से निवेदन है कि प्लीज बैठ जाएं. Ladies and gentlemen, a very, very good morning and a very warm welcome to the Medical Research Summit and prestigious Blackbuck Awards for Medical Research organized by Medical Dialogues. I am Juhi Malhotra and I am absolutely thrilled to be your host today at this incredible gathering of some of the brightest minds in healthcare and medical research. Ladies and gentlemen, we have gathered here today to honor innovation, tackle challenges, and exchange insights that will influence the future of healthcare in India and around the world. Our agenda today is packed with thought-provoking panel discussions that promise to engage and inspire us all. And of course, we all look forward with great anticipation to the highlight of our day, the prestigious Blackbuck Awards ceremony, where we will celebrate the outstanding achievements and pioneering spirit of our medical research community. I want to extend a very warm welcome to our esteemed guests, our distinguished speakers and dedicated researchers who have joined us here today. Ladies and gentlemen, as we begin, I would like to invite our chief guest for the day, Dr. AVS Ramesh Chandra, Additional Secretary, Ministry of External Affairs, Government of India, to the dais, please. Zordar taliyon ke saath abhinandan. I would also request Dr. Prem Agarwal, Chairman, Medical Dialogues, Dr. Kamal Kant Kohli, Chief Editor, Medical News at Medical Dialogues. May I request Ms. Meghna Singhania, Editor-in-Chief, Medical Dialogues, Shri Pritesh Sheth, CEO, Scientific Scholar, and Dr. Naresh Goyal, Program Director, Medical Research Summit and Blackbuck Awards, to please escort our chief guest and please accompany him on the dais. Ladies and gentlemen, please join hands for our dignitaries who have joined us here as we kickstart the proceedings for the day. बहुत बहुत अभिनंदन, बहुत बहुत स्वागत. Thank you for joining us here today. Ladies and gentlemen, हमारे देश की हजारों वर्षों से एक परंपरा है जहां पर हम कहते हैं अतिथि देवो भव. अतिथियों का स्वागत सत्कार करना हमने शुरू से ही अपना परम धर्म माना है. मैं प्लीज रिक्वेस्ट Dr. Prem Agarwal to welcome our chief guest by presenting him with a beautiful flower bouquet. Welcoming our chief guest, Dr. AVS Ramesh Chandra, Additional Secretary, Ministry of External Affairs, by presenting him with a beautiful flower bouquet, celebrating his presence here today amongst us. एक और बहुत ही खूबसूरत परंपरा जहां ईश्वर का नाम लेते हैं और दीप प्रज्वलन के साथ किसी कार्यक्रम को आगे बढ़ाते हैं. May I please request Honorable Chief Guest and other dignitaries on the dais to kindly light the ceremonial lamp and formally begin the proceedings for the day. Lamp lighting. माना जाता है कि सफर है अज्ञान से ज्ञान की ओर. अंधकार से प्रकाश की ओर, प्राणी से परमात्मा की ओर.
सा
the ceremonial lighting of the lamp. Ladies and gentlemen, as they say that this symbolizes the enlightenment and guidance that we seek through our discussions and interactions here today. सभी से निवेदन कि अपने स्थान को वापस ग्रहण करें और जैसा कि कहते हैं कि अज्ञान से ज्ञान की ओर, अंधकार से प्रकाश की ओर, पदार्थ से सूक्ष्म की ओर, प्राणी से परमात्मा की ओर. Ladies and gentlemen, we have begun the day on this auspicious note, and now it is my honor to invite Dr. Prem Agarwal, Chairman Medical Dialogues, to please welcome our august gathering today and set the tone by presenting the welcome address. Please put your hands together for Dr. Prem Agarwal.
स्वागत है आप सबका, and especially our chief guest today in the morning, Shri Ramesh Chandra ji. I welcome you all to this function today, which we are calling a research summit. And we have decided to recognize and honor some of us who have excelled into the field of medical research. दोस्तों, मेडिकल डायलॉग अब काफ़ी साल पुराना हो गया और being the largest news portal in the country with more than 7 lakh registered doctors and 30 lakhs clicks a month. It is carrying news across the country. कश्मीर से कन्याकुमारी तक अगर कोई खबर है जो डॉक्टर्स के से रिलेटेड है, चाहे वो हैपनिंग है, चाहे वो रिसर्च है, चाहे वो डूइंग है, चाहे हेल्थ पॉलिसीज़ हैं, कमिंग फ्रॉम एनी सेक्टर, if it is impacting the health of the doctors, the mental, physical, or even working health of the doctors, it is there in medical dialogue. And today, medical dialogue has become a treatise for medical information. And in fact, कई बार कोई केस होता है कोर्ट में तो वकील लोग आते हैं, साहब बता दीजिए इनके पर्टिकुलर्स क्या है, वायलेंस कितने लोगों में वायलेंस हुई, कितने लोगों ने रिसर्च करी, क्या किया, कैसे किया. So this has been not in one day, this has been developing slowly. And every year we thought that we have become a little bigger, more stronger. But at the same time, we strongly felt that the ills of this country's healthcare is lying in the mismatch between the health financing and healthcare infrastructure. In fact, medical research remains the most important aspect of the healthcare because where we discover new treatments and strengths and also discard few of the last known what we knew before. For this 145 crore population of the country, the healthcare requirements, infrastructure, as well as financing them is becoming an unsurmountable task for any country program mayors. Most of the products which are called high-class innovations are coming from foreign. We have got a very strong experience and literature which coming from the ancient history. But the modern science was generated only when we were slaves. At that time, there was no avenue for our country to develop medical health research. So indigenous medical research is still in infancy. And in fact, 80% of the quality products we are importing. And that importing we are at a very high cost, creating a great mismatch on the finance availability and the need for the infrastructure. 70,000 crores has been depicted by the health government this year, 78,000, 90,000 rupees. But that is still too meager. And most of them are balancing and hoping that this particular need of healthcare will come from the out of the pocket. And it is shameful that in our country we have 50% of our expenses are out of the pocket. Because whatever the country may produce or may give will be incompetent and inappropriate. Because of only one reason, that we have not identified the most important aspect of our country, is health research. Because we are not creating things in our country. Saying that we cannot is not right. If we can create Chandrayaan, if we can go to Mangal, if we can create missiles, we can create a supercomputer, we can create everything which we want, we can create a COVID vaccine. If we can create whatever we want, the only thing, the intention of the government is not very perfect, that the health research needs priority. And that is the reason when I thought that we will have a meeting on health research, a lot of people, of my friends, told me that चलेगा नहीं यार ये, सेल नहीं होगा. सेल नहीं मतलब इसके पैसे नहीं मिलेंगे, कोई फाइनेंशियल नहीं मिलेगा, और लोग अटेंड करने भी नहीं आएंगे. मैं कहा कोई बात नहीं, we'll have a function, we'll have a meeting, we'll have a stimulation event. That health research is the most important aspect of the health care. इस बार इन्होंने 4,000 करोड़ रुपए लगा दिए. 4,000 crores has been dedicated for health research out of the health budget. और वो सारा का सारा हमारी मदर ऑर्गेनाइजेशन ICMR को मिल जाएगा. ICMR की अपनी इश्यूज हैं, अपनी प्रॉब्लम्स हैं, एंड दे विल स्पेंड, दे हैव बीन ए पायनियर, नो डिबेट. लेकिन वो सारा का सारा अगर मैं सोचूं कि देश का सारा हेल्थ रिसर्च ICMR से आएगा, तो वो प्रोग्रामर्स के लिए, मेरे लिए, सबके लिए अनएक्सेप्टेबल है. क्योंकि रिसर्च तो छोटी इंस्टीट्यूशन में होती है, और छोटी इंस्टीट्यूशंस ग्रॉसली इनएडिक्वेट हैं. उनके लिए एनवायरनमेंट नहीं है, इंफ्रास्ट्रक्चर नहीं है, सामान नहीं है, एक कैरेक्टर नहीं है. एजुकेशन, हमारी एजुकेशन टोटली इज डेडिकेटेड टू क्रिएटिंग ए क्लिनिकल डॉक्टर, नॉट ए रिसर्चर. सो पहले दिन से ही हम लोग डॉक्टर बनना चाहते हैं. डॉक्टर का मेजर काम तो ये है ना कि क्या नया बनना है. एनीवे, for that we have called the best of the people in the trade research to discuss. Today they will deliberate, maybe something positive will come out, and we'll compile the deliberation with the strength of medical dialogue, which is increasing every day. We'll spread it out and we'll try to fight it out. बहुत सारी क्रिएशंस एक छोटी चाय पे होती हैं, और मुझे श्योर है कि आप मेडिकल रिसर्च को जो प्रमोट करने का प्रोग्राम आज आप लोगों ने और हम लोगों ने लिया है, it will become a fire, and very soon we will be able to create so much of indigenous medical research that we are able to control the financing and be able to strengthen the health structure. With these few words, I thank you all, and I call upon Shri Ramesh Chandra ji, who is also a doctor, but he is gone to IFS, and Neha will tell you more about him. But I'm sure that with his help and with his guidance, seniors are always there to help us. Okay? Please introduce Mr. Mitchell.
Very rightly said, sir. Health research is the most important aspect of healthcare, and all of us need to focus on it for the bright future of our country and, of course, for the entire world. Ladies and gentlemen, after those inspiring words by Dr. Prem Agarwal, we'll now be inviting our chief guest who's been kind enough to join us today on our invitation. We have amongst us Dr. AVS Ramesh Chandra, a distinguished officer of the Indian Foreign Service who's been serving the nation since 1989. In August 2024, he begins his 36th year in service and is currently holding the position of Additional Secretary at the Ministry of External Affairs. He served in various capacities and has held numerous important positions in the Government of India. In Delhi, his most recent deputation was to the South Asian University as officer on special duty and was acting president of the university. His achievements include being appointed as the High Commissioner of India to Uganda and Rwanda and as Ambassador of India to Burundi. His last assignment as ambassador was to Romania, Moldova, and Albania in Central Europe. He's been a senior diplomat at the Indian embassies in Turkey, where he was charge d'affaires Russia, Pakistan, and Afghanistan. He was India's delegate at the Permanent Mission of India to the United Nations in New York, Deputy Director General of the Indian Council of World Affairs, and was in the Ministry of Defense in Delhi, and the list goes on. He holds a master's degree in veterinary science, majoring in dairy technology from the Andhra Pradesh Agricultural University, Hyderabad, and has received several gold medals for academic excellence. Ladies and gentlemen, please put your hands together for our chief guest, Dr. AVS Ramesh Chandra, जिनको उनके एड्रेस के लिए अब हम इनवाइट करते हैं. बहुत बहुत स्वागत.
Thank you for the introduction. I really feel humbled. Vaidyo Narayano Harihi. Dr. Prem Agrawal, President of the National Medical Forum and Chairman and Co-founder of the Medical Dialogues. Dr. Naresh Goyal, Advisor. Dr. Ashok Bagga, Director. Ms. Meghna Singhania, Chief Editor of the journal Medical Dialogues. Proud winners of the Blackbuck Awards in all categories. The Blackbuck, as a veterinary surgeon, I know stands for resilience. I hope all the awardees will be as resilient as the Blackbuck. Members of the media, a very good morning. The Charaka Samhita, authored some 2000 years ago, says, Sharire Jarjara Bhute Vyadhigraste Kalebare Jannavi Toyam Vaidyo Narayano Harihi. The doctor is said to be the embodiment of God himself. The exact dates of origin of the Charaka Samhita remain unclear, but it is acknowledged by scholars worldwide that it flourished for a 400 period between 2nd century BCE and 2nd century CE, the Common Era. The Encyclopedia Britannica, updated by Cara Rogers of the United Kingdom recently and revised, refers to the Charaka Samhita as a comprehensive text on ancient Indian medicine and to Charaka himself as a practitioner of traditional system of Indian medicine. The scholar Cara Rogers also suggests that the Charaka Samhita may have been refined and rewritten by Charaka from texts written several centuries earlier by Agnivesha, one of 6 disciples of Punarvasu Atreya. I found it also to be of interest because my birth star is Punarvasu. So we are referring to texts nearly 2500 years before today. I do not have any doubts on the credentials of Encyclopedia Britannica, a set of which I received from my father-in-law some 35 years ago. And I'll come back to this important subject on the crying need in this country for good research and for preservation and sharing of records in a minute or two. If there is one person in this august audience with a capacity to correct my reference to the shloka from Charaka Samhita, it has to be my childhood friend, Dr. Srinivas Ramaka, a cardiologist of eminence in Telangana. Srini, can you please rise? The shloka is Sharire Jarjara Bhute Vyadhigraste Kalebare Jannavi Toyam Vaidyo Narayano Harihi. Srini and I studied Sanskrit together at the AP Residential Junior College in Nagarjun Sagar some 44 years ago in 1980. He was a topper in our batch in Sanskrit. Can we have a round of applause for that scholarship? It is primarily at his urging and the persuasive skills of both Dr. Prem Agrawal ji and Meghna Singhania ji that I am in your presence today. I told Srini, spare me my Sunday. I have approval from Government of India to incur a significant amount of expenditure for digitizing my records. He suggested that this was precisely why I should be airing my views today, and he actually helped me. Um, he suggested that a maintenance of records and then digitizing them over a period of time will be of key and crucial significance. I cannot agree more with him on this. I think I've done 5 minutes, but and Meghna ji is looking around nervously. I'll just have 4 or 5 points to make before I go back to my chair. First, COVID-19. There is a nationwide appreciation among ordinary people in India for the dedication with which doctors, paramedical support staff, many small hospitals, and importantly, the administrators and law enforcement agencies stood up together in the largest populated country on planet Earth. Effectively and collectively, we did not see tens of thousands of body bags reaching Azadpur Mandi in July 2020. It is very easy to forget that this was just 4 years ago. My suggestion is for this medical research summit and the medical dialogues to look at Srinivas Ramaka's work on the registry on out-of-hospital cardiac arrests that he did for Warangal. It will be useful if a similar registry can be attempted with reference to COVID-19, but with a difference. Ideally on lessons learned from handling of COVID-19. Can Medical Dialogues 2024 in Delhi look at existing capacities that are in India if a more serious pandemic strikes us, God forbid, in 2025 or 2026? We in the Ministry of External Affairs, under the able and dynamic leadership of my minister, Dr. Subramaniam Jayashankar, ensured that vaccines were available in adequate quantities, not just for needs of our population, but also for people of 140 other countries. There is no other country on planet Earth, I repeat, there is no other country on planet Earth that has been able to do this, not even the country that presented the virus to the world. Second, my friend Srini may perhaps be the first medical professional and scholar from the private sector to be supervising work of a PhD student in Telangana. I'm confident that our colleague of the same name, Srinivas from National Medical Council, who I'm told will be in the afternoon session, will take note of this and make needed adjustments to its policies and regulations with a sense of urgency. Unless we in government adapt, we will perish. Third, our Honorable Prime Minister Narendra Modi ji's mantra has been Sabke Saath, Sabka Vikas. This philosophy has been running in tandem with Honorable Pradhan Mantri ji repeating ad nauseum our innate and very sincere belief in Vasudhaiva Kutumbakam. The whole world is a family. And Sarve Jana Sukhino Bhavantu. Let all people be happy. All our embassies and high commissions abroad covering the 200 odd countries in the world have and continue to reach out to our friends abroad with our Shanti mantras for global peace. As High Commissioner in Uganda in 2014, I was a small instrument in ensuring that the Foreign Minister of Uganda, Sam Kutesa, as President of the UN General Assembly, enabled a declaration of 21 June as the International Day of Yoga. Some 177 countries supported us unconditionally. I think we must take great pride from this. Medical researchers in India must look at how much of this has happened within India in the past 10 years alone, and whether our Ayush ministry has been able to deliver. When you're looking at Ayurveda, when you're looking at Unani medicine, when you're looking at Siddha medicine, when you're looking at homeopathy, I think we need a coordinated approach at a very minimum. Fourth, the Medical Research Summit, Dr. Agarwal ji must try and look at the present admin setup for medical care in the United States of America. When someone dials 911, the person at the other end has the medical record of the patient in a flash. When someone dials 911, the medical superintendent who is receiving the call, within a flash of a second has the medical record appearing before his or her computer screen. What can we here in India do to have real-time data available with ease of retrieval from e-records when they are needed? Will establishment of an institute such as the National Institute of Health, for example, in India, help us better in addressing ill health and in pacing towards a Vikasit Bharat by 2047, marking 100 years of independence in this phase of Bharat's existence as an independent nation state? Fifth, this medical research summit should attempt recommending budgetary support to all medical colleges for research, which is very sadly only for completing a thesis or to get a promotion. There is no accompanying passion for research. Every medical college in the country should obligatorily have a research board. It is not a utopian thought. Sixth, every doctor receiving a Blackbuck award today, including my friend from college days who's receiving a Stellar Researcher Award. Congratulations, Srini. Irrespective of the category, whether it's a pioneer or stellar researcher or rising researcher award under the age of 45 years, must necessarily work to see why even 10% of those in the 110,000 MBBS seats in medical colleges in India today, or the approximately 47,000 odd seats in MD and MS specialties, are not being able to contribute to research. 541 colleges are churning out MDs and MSs. Just a last set of points. Disparities in allocation of funds for research to various institutions. You referred to this earlier on. The ICMR, the Department of Science and Technology, and others must look at concerted ways in which the funding of medical institutions can be regulated. So what can be done to enhance pharmacovigilance? Today, that's an area of concern. I know I'm taking more time than necessary, but I'll quickly run through the remaining 1 or 2 points. How can greater grit, determination, and efficiency be suffused into medical colleges in India for focused research on ways and means of improving medical care in India? Is there a possibility of leveraging available machine learning models and artificial intelligence to add to clinical data to predict and forewarn when it comes to communicable diseases? Again, my reference point is Srini Ramaka, who's developed a machine learning model utilizing artificial intelligence to predict sudden death in cases of cardiac arrest. An analysis, I think, of 5 A's are expected in my assessment of a medical professional: creating awareness, being accessible, being affordable, most importantly, being affable, and finally being accountable. I think the practice of medicine is truly an art. The art of practice of medicine includes an awareness in the community when it comes to health, promoting this awareness. Research, again, community-oriented research, and not just that conducted in labs with test tubes and solutions. Treating the T part of the art certainly includes treating, but also I suppose an important component would necessarily have to be teaching and training the next generation of medical professionals. I think this is where we have been lacking, largely because doctors simply do not have time to record for posterity their experiences, how they have handled a particular patient. The doctors in India are very, very uniquely placed. I was in Romania on my last ambassadorial, and I can tell you, a doctor there probably will be very lucky if he treats about 10 patients in a day. Compare that with a doctor in the All India Institute of Medical Sciences. I've had colleagues and batchmates who have come out from All India Institute of Medical Sciences, joining the Foreign Service. If I were to meet an average doctor, he is overburdened from the minute he reaches the hospital. He has no time to spare at all. So if you are imagining he's treating about 200 or so patients in a day, compare that with the 10 or 12 patients that a doctor or Romanian doctor is treating on a daily basis, and look at the kind of experience that is forthcoming to an Indian doctor, even mid-career Indian doctor. So I think we should draw great solace and great strength from this very fact. I wish to once again congratulate you, Dr. Agrawalji, having 7 lakh registered members on your portal. I think it's a commendable achievement. And insofar as my personal self-interest goes, I should be able to get information on Charaka Samhita, or for that matter Susruta, from this portal without having to refer to the A to Z series of Encyclopedia Britannica, for God's sake. मैं आपका आभारी हूँ कि आपने ये मौका दिया मुझे यहाँ पे आने का. I wish this venture every success. मेरा भाषण जो है एक criticism के रूप में मत लीजिएगा. It was just an attempt at a critical look at the possibility of community-oriented research taking root in this great country of ours. Jai Hind.
The practice of medicine is truly an art, as you said, sir. We totally agree with it. Thank you, sir, for your words of wisdom and guidance to the research community. And as they say, that community is not just another stakeholder in the business, but the very purpose of existence of any enterprise. We really hope that the discussions we'll have today be beneficial to entire humanity. Thank you for joining us here today. May I please request Dr. Prem Agarwal, Chairman Medical Dialogues, to present a token of respect and acknowledgement for our chief guest who's joined us here today at our request. Ladies and gentlemen, presenting a memento to Dr. AVS Ramesh Chandra. Thank you, sir, for joining us here today. Dr. AVS Ramesh Chandra, Additional Secretary, Ministry of External Affairs, Government of India. Thank you very much, sir, for being here today with us. बहुत बहुत आभार. एक बार पुनः जोरदार तालियां हमारे मुख्य अतिथि महोदय के लिए. और इसके बाद अब हम हमारे साइंटिफिक सेशंस में डेल्व करेंगे और मैं निवेदन करना चाहूंगी डॉक्टर कमलकांत कोहली, who will now take over the proceedings of the scientific sessions from here. Ladies and gentlemen, Dr. Kamalkant Kohli, as we know, the Chief Editor, Medical News at Medical Dialogues, will now present the scientific sessions. Sir.
Good morning, ladies and gentlemen. We are now going to start the scientific program that includes 5 panel discussions. Friends, each session will be 25 minutes. Bell will be sounded after 20 minutes as an indication to moderator to wind up. We have a battery of eminent panelists for today's program to make this scientific feast more wholesome. I'm sure all of us are going to be immensely benefited by today's deliberations. Friends, our first discussion is on medical research in India, challenges and opportunities. I'll request chairperson of this session, Dr. Naresh Goyal, moderator Dr. Ashok Kumar Bagga, panelists Dr. S.V. Madhu, Dr. Ashwani Kumar Setia, Dr. Manish Singhal, and Dr. Rupa Shivashankar to kindly join us on stage and be seated. All the panelists and moderator for first session are requested to come to dais. Let me quickly introduce our panelists and chairperson. Our chairperson for this session, Dr. Naresh Goel, after retiring as Deputy Director General at Ministry of Health, is currently engaged as advisor to medical dialogues. Moderator Dr. Ashok Kumar Bagga, a former Deputy Director General of ICMR, is an avid researcher with expertise in various areas like ELISA, cell tumor, and molecular biology. Dr. S.V. Madhu, an endocrinologist par excellence, is at present Director and Professor at Department of Endocrinology and Center for Diabetes, Endocrinology and Metabolism, UCMS and GTB Hospital, Delhi. Dr. Ashwani Kumar Setia, a senior gastroenterologist, is a distinguished advisor and consultant in medical law and ethics. Dr. Manish Singhal is head of Department of Plastic, Reconstructive and Burn Surgery at AIIMS. He has authored more than 120 publications and is widely cited in his field, contributing significantly to surgical practice and research. Dr. Rupa Shivashankar is a senior scientist at ICMR, specializing in non-communicable diseases research with 15 years of experience and with over 80 research articles to her credit. I'll now hand over mic to Dr. Ashok Kumar Bagga, moderator, for further conduction of this panel discussion. Dr. Ashok Kumar Bagga.
Good morning, everybody. First of all, I will thank Medical Dialogues, Dr. Prem Agarwal, Dr. Meghna Singhania, and Dr. Kamal Kant to give us an opportunity to highlight the very important aspect of medical science. So here we have the first session, which is regarding the opportunities and challenges in medical research. So the first speaker in this will be Dr. S.V. Madhu. Yeah, I would invite Dr. S.V. Madhu, who is Director in Endocrinology and Center for Diabetes in GTB Hospital, a pioneer in endocrinology and metabolic diseases. Dr. S.V. Madhu.
Just speak. Yeah. Or any questions?
Shall I ask questions? Yeah. Okay, thank you.
Thank you, Dr. Bagga. Now, as a moderator, you may ask the panelists regarding certain issues that are challenges and opportunities in medical research. Thank you very much.
As we start this panel discussion, Dr. Madhu has an immense experience in treating dyslipidemias, metabolic diseases, and especially diabetes, which is one of the commonest metabolic diseases today. So I would request Dr. Madhu to highlight both on the educational and research aspects in diabetes and endocrinology, as well as what message he has for the doctors to initiate and promote research in this field.
Thank you, Dr. Bagga. It's not just in the field of dyslipidemia and endocrinology, but in general, medical research. I think, as has been stressed in the morning by the chief guest as well as Dr. Prem Agarwal, we need to change our temper. Scientific temper and medical research mindset has to come and get ingrained in all practicing medical physicians. We should start believing that, clinical care should include research as an essential component. What is clinical care today was yesterday's research, and therefore research today will become clinical care tomorrow. And it's a continuum, and therefore it's an integral part. And those who believe that they're doing great service just by clinical care should also ponder on the fact that, it's equally important to conduct medical research. And it's not difficult, because we are all, as clinicians and dealing with patients, we have an inquisitive mind. In fact, every patient is a kind of a research, because one patient is different from the other. And we just need to extrapolate it, extend it, document what you're doing. And we heard about electronic records, for example, and that itself can become a case series or a research or a starting point for a research. And then from then on, carry on into more formal research, which can be of national priority. So I think my message basically would be for all physicians or all clinicians is that get it into your mind that research is an essential part of clinical care.
Dr. Madhu, I would like to ask you one question. Whether we should include separate chapters on diabetes and dyslipidemias in undergraduate research studies, or
Yeah, with respect to diabetes, I definitely feel so. It's a national priority. It's a public health problem, and we all know that one of the biggest epidemics in our country is that of diabetes, and it's rising by the day. And therefore, every medical practitioner, every medical student has to know enough about diabetes and the related dyslipidemia, and therefore it should certainly be part of the medical curriculum, not only in terms of training, but I think something to stimulate the students at the MBBS level itself to undertake some kind of a research in these areas also probably would be welcome, apart from just a chapter.
Thanks, Dr. Madhu. I would like that you highlight some of the future areas for diabetes, if you have in mind. Future areas, one or two future areas. I mean, the future problems which you can think of.
Future areas.
Yeah.
See, if we are talking about national priorities, then prevention of diabetes, I think, is one of the important areas. And more indigenous methods, for example, that are available to our country since ancient times, how effective they would be in preventing diabetes, that probably will be one of the major focus areas that I think most researchers in our country should focus. In terms of understanding the disease processes, with respect to diabetes, for example, we all know, and probably many of us are aware, that Indians differ from the Westerners and Caucasians in several ways in how the disease biology of diabetes exists, what is the natural history, and how we respond to various therapeutic agents. And therefore, research needs to be focused within our country to generate data of our own, not only in terms of epidemiology, but also in terms of the mechanisms involved. For example, our research and many other researchers also have shown that we have a unique phenotype, what we call the Asian Indian phenotype, which predisposes to diabetes. And the mechanisms involved therein, and probably adipose tissue is very important in our country, not as much in other countries. Therefore, I think these are some areas on which Indian researchers can focus in the area of diabetes.
Thank you very much, Dr. Madhu. I hope our young researchers and upcoming researchers will have a lot of questions in their mind due to your talks and your views. Now, I will invite Dr. Ashwini Kumar Setia, who is Senior Consultant in Medanta Institute, and he is a specialist on gastroenterology and legal aspects of medical research. Dr. Setia, please.
You have any questions, or shall I start an example? Okay.
First, give your views.
Okay. Legal aspects are a very wide subject, and just in 3 to 4 minutes, I think I would not like to waste time of this august audience. I would like to just stress on a couple of points. First, ignorance of law is no excuse, and ignorance of law excuses no one. Therefore, anything that is governed by a certain set of rules we have to be aware of that. As far as research is concerned, I would like to just make 2 points here. There is no point talking of the acts that govern the medical research, that is Drugs and Cosmetics Act, or 1940, or the rules 1945, and the Helsinki Declaration, etc. All I would like to say is that I would like to sensitize you on 2 aspects. The pivot for research is consent. It revolves around consent, and the Supreme Court, the Honorable Supreme Court, has issued guidelines for consent in basically treating the patients. There is some difference which comes in when you are doing research. So the consent guidelines were issued in Samira Kohli versus Prabha Manchanda case. The difference is that in addition to what you're taking as far as the clinical part is concerned, you have to give an extra information. The consent has to be what is called as FPIC, that is free, prior, informed consent. It has to be under no coercion, under no inducements. The patient must know, the patient or the research subject, the participant, must know why this is being done, if it is a drug trial, what are the likely bad effects, and the fact that he can withdraw at any given time. I would like to take this opportunity to sensitize everyone here to the new law, that is the Bharatiya Nyaya Sanhita, which is a criminal law. Why should criminal law come in here? Because if you touch a patient without consent, then it attracts criminal provisions, it's assault, and if you touch a patient, it's a battery. 1. Second, during the process of research, if there is an allegation of medical negligence and the patient dies, then it attracts criminal provisions. Earlier on, in the IPC, it was 304A, where the punishment was 2 years of jail. Now, unfortunately, it is the medical negligence word has crept in this law for the first time. Death by negligence as medical negligence under section 106, subsection 2, where the punishment is 2 years, but there is fine, etc. Why I want to tell you this is because not many people are aware that for death the punishment is 2 years.
Right.
Whereas in the same law, under section 117, subsection 3, if the patient during the course of treatment or research has developed vegetative state or a permanent disability, the sentence is 10 years of rigorous imprisonment.
Right.
Right? And therefore, anybody who knows, all doctors we know, that during the course of resuscitation of a patient, the life may be saved, but he may be having a permanent disability, or he may be having a vegetative state. So does it mean that my teachers who have told me that, okay, you should do utmost to save a patient's life, then I would not do it because of this hanging sword of this law?
Right. So here comes again another issue of ethical clearance and ethical issues regarding medical research. So I would like your views in 2 minutes, please. And the hairline difference comes between ethics and non-ethics. So how to get rid of any complications arising out of ethical issues?
So just the example which I gave you, ethics tell me to do my utmost to save a patient's life, and I'm scared because of this reason. So I say that law is derived from old Teutonic word lag, which means fixed. So law is what it is, ethics is what it should be, right? And there's a difference. So a thing which may appear ethical, it doesn't necessarily mean it's legal, and vice versa is also true. So for ethics, we have to see 2 or 3 things. Autonomy of the body is most important. Second, beneficence.
Right.
Third, confidentiality. fourth, do no harm, and fifth, justice.
Here's another question that are you aware, maybe our medical community may be aware, that many of the smaller institutions where research is being carried out, they don't have ethical committees. So, which is, I think, a must. Can you throw some light on this?
So for every research to come into being, it has to go through the muster, pass through the muster of institutional ethical committee. But the challenge is that although there are guidelines on the constitution of these ethical committees, unfortunately, not many people in those committees know what ethics is and how they have to apply it. So most of the people who are doctors or scientists, one of the persons is supposed to be from the non-scientific background, and similarly representing the patients. The doctors do not know. They are more mired in the technical aspect of it, which of course they have to do as far as the protocol is concerned. They have to approve of that, but also the ethics, right? As far as the representative from which is non-medical, non-scientific background, he doesn't know what his rights are. The patient doesn't know what his rights are. And therefore, we kind of don't observe the ethics that they should be, and we skirt around that.
Thanks a lot, Dr. Ashwini. We have told us many experiences about your thing, and I think they'll be useful for the new researchers. Now, I would speak to Dr. Manish Singalji. He's head of Department of Plastic Surgery and Reconstructive and Burn Surgery in All India Institute of Medical Sciences. So, Dr. Singal, you have immense experience on this aspect. I would like you to throw some experiences, light on your experiences about what are future research areas possible in your field.
So, sir, I think if I particularly go to my particular field, so we treat a lot of burns, and we are fortunately or unfortunately the burn capital of the world. So we have the maximum burns in the world. So I think we can throw a lot of light on the West and on the other countries as far as burns are concerned. And just taking few examples, that the fluid calculation in burns or the basic nutrition in burns has changed a lot in past few years, and we are just following whatever West says. We have a very different climate, we have a very different environment, and we have a very different infection. Now with so much change of AMR, antibiotic resistance, I think we are the people who can lead this at all fronts, I feel, particularly if I tell about my particular field.
Right. You have got good hand on in these things. I would like you to throw some light on any possibility of international collaborations which can be of use to India in these areas of research.
So once we talk about international collaboration, luckily we are in some of the international collaborations, and we have to understand very clearly few things. Number one, we have a strength of clinical work, but at the same time we have a weakness that we lack very specific protocols. And once we don't have very specific protocols, you cannot do research. So we have to have very specific protocols, and most of the time it is a senior most person who says that this is the treatment and people will follow that. And once you don't have those protocols, number two, we have to understand that we have an inbuilt, our medical training gives us inbuilt clinical knowledge. But if you go to the West, particularly United States, when I say West, so if you see the person who will enter into medical field is already a biomedical engineer.
Yeah.
He has already done MSc, BSc in statistics or in some particular bachelor course. Now they have a very strong research background before entering to MBBS. And we have a person who is a clinician and a researcher. Now here we do it as a burden. Right. It is extra. So unless and until by NMC we develop very strong into the curriculum, maybe the first year of medicine, just be at par with West for research.
Really, that's good. Thank you, sir. Now I would go to my own parent institute's scientist, Dr. Rupa. So I would like to tell us about the current landscape of medical research in India. I think in working in NCD division of ICMR, you must be having a good information about it.
Thank you so much, Dr. Bagga, and thank you for inviting me to be part of this August gathering. That's a very loaded question to talk about the whole landscape of medical research in India. I mean, I can just talk more about what are the potentials that exist within the medical research in India. And Honorable Ramesh Chandraji in the morning touched upon this matter, right? So number one, our strength, whatever said and done, is the population, right? The humongous population, what we have got, and the number of patients, what we see in our country, can be unmatched with. The example he took between Romania and India is a very important example, right? And most of the clinical trials, when I get it in, whether it is the application through Health Ministry Steering Committee or others, I know they all want India to be part of their research just for the sheer numbers. And we should use that strength as a medical research community. Second is diversity. The diversity of population in our country is huge. And third is trained clinician. We have huge number of trained clinician and physician, which we export a lot to the other countries, but we have humongous number. There is infrastructure. There is governance for research, at least it's improving, and we are not like, it may not be perfect, but we are improving over time with the governance of research. So, and we are also pharmaceutical capital of the world, and even there is improvement in what you call the bioengineering parts of the country, biotechnology in the country. So, yeah, but given all this, where do we lack? Where do we lack? I think what Dr. Singhal touched upon is a very important. We don't have the research-trained clinicians, right? Whether even the MD thesis are done in a very shabby way in a most part of our country, and not to blame the residents or the clinicians, it's only because they don't have a protected time to conduct research, which is unfortunate. And the people who are sitting next to me, Dr. Singhal and Dr. Madhu, they really go out of their way, like they take up their weekends and other times to do research.
I'll intervene. As you are from ICMR, do you see any change in the role of ICMR and the government agencies in funding research all over India?
Do I see?
You see any change in the role of ICMR and other governmental agencies in funding the research?
Yes, sir. So recently we have humongously changed the way we fund research in the extramural mechanism at ICMR. So we've got very different ways of providing research funding, which is quite huge amount.
We have intramural and extramural research.
Correct. The intramural is only for the ICMR institutions, while the extramural is for outside of ICMR institution. So under the extramural, there are small grants up to 2 crores per research, and there are intermediate grants which is given to the mid and high level researchers, which varies from 2 to 8 crores, and there are Center for Excellence in Research, which is up to 15 crores. Beyond this, we are trying to conduct what we call as national health priority research, that is converting evidence and guidelines into actual actions on the field, and that's very important. I think somebody touched upon, and Dr. Madhu explained like how much of work is required, for instance, in diabetes in terms of research. But unfortunately, even the basics of diabetic care, whether it is providing an adequate diagnostic of basic metformin and oral hypoglycemic medicines, is not available to the most patients. How do we ensure these are provided in a very systematic manner? Is all the implementation research what we have to look at.
Really, thank you. Our panelists have thrown light on various aspects of medical research and the opportunities and challenges. So there are several challenges, but opportunities are also quite a bit. So we have to avail the opportunities and face the challenges, and the young researchers will have a good message in their own field of interest as far as the medical research goes, and they have to encourage the medical research, and medical dialogues is here to promote medical research and create more awareness. Thank you, my panelists.
Thank you, Dr. Naresh Goyal, Dr. Ashok Bagga, and our esteemed panelists for a truly enlightening discussion. Ladies and gentlemen, let's give them a big round of applause for such an enlightening discussion. Now I'll request Dr. Naresh Goyal to hand over mementos to moderator Dr. Ashok Kumar Bagga. Dr. Ashwani Kumar Setya. Dr. S.V. Madhu. Dr. Madhu. Dr. Manish Singhal. And Dr. Rupa Shivashankar. I'll request Meghna to kindly honor our chairperson for this session, Dr. Naresh Goyal. Meghna to kindly hand over memento to Dr. Naresh Goyal. Ladies and gentlemen, let's move on to our second session. Our second session is publication of medical research, obstacles and innovations. Our next session is on publication of medical research, obstacles and innovations. I'll request chairperson of the session, Dr. Arun Kumar Agarwal, moderator Dr. Jigar Dattani, and panelists Dr. Naren Agarwal, Dr. Geetika Sareen, Dr. Sunny Datta Gupta, and Dr. Raju Vaishya to kindly come over to dais and be seated. Ladies and gentlemen, our chairperson, Dr. Arun Kumar Agarwal, is a distinguished ENT surgeon, former dean of Maulana Azad Medical College, and a researcher and teacher par excellence with over 35 years of experience. Incidentally, he was chairperson of Delhi Medical Council also. Moderator of this session, Dr. Jigar Dattani, is Director, Medical and Healthcare Communications at Medical Dialogues. Dr. Naren Agarwal is Editorial Director for Medicine, Biomedical and Life Sciences books in Asia at Springer Nature. Dr. Agarwal is dedicated to advancing scientific knowledge through his work in book publishing and holds a pivotal role in the development of cutting-edge publications. Dr. Geetika Sareen, Associate Director and Business Head for Journals at JP Health Science Publishers, has over
25 years of experience in STM publishing, program management and marketing communications. A strategic thinker, she excels in scaling operations, forging partnerships, and driving innovative publishing solutions. Dr. Sunny Datta Gupta, Director of Publishing at Scientific Scholar, has been a key figure in open access clinical publishing fraternity, specializing in journal development and strategic acquisitions. He has successfully managed prominent journals like Indian Journal of Medical Research and Indian Journal of Radiology and Imaging. Dr. Professor Raju Vaishya, Senior Consultant Orthopedic Surgeon at IP Apollo Hospital, has over 800 publications. He has been listed among the top 2% of global scientists by Stanford University for 3 consecutive years, underscoring his impact in the field of research. I'll now request Dr. Jigar Dattani to kindly take over and moderate the panel discussion.
Thank you so much.
Dattani.
Thank you so much, Dr. Kohli. A very good morning to each one of you. This session is about publication of medical research, obstacles and innovations. We all know that publication is the last lap, but it is such a critical part to formalize a research. And it is a big challenge for medical researchers, which creates a kind of an inertia. And today we have a group of panelists, very esteemed panelists from diverse backgrounds, and we try to understand this area in more detail. So to open up the session, I would request our chairperson, Dr. A.K. Agarwal, to give us a quick overview on what are the challenges pertaining to medical publication that you would have seen over the years based on your experience.
Thank you. Thank you, Medical Dialogue, for giving us this opportunity. It's a wonderful subject we have been discussing since morning. And publication and medical research. I would like to give my personal opinion about it. I am into medical education for last little 45 years. You know the strength of India. As just now, our colleague from ICMR, Dr. Rupa said, I always emphasize something that the unfortunate big numbers of suffering, we are big in numbers. That is good thing. But their suffering is also big. That means that is unfortunate. But this unfortunate status of big number of suffering can become a boon for medical education and medical research. Dr. Raju Vaishya, you will agree with me. There are countries, very small countries, very limited cases, but they are perhaps trying to drive the medical education and research in a much better than we are doing it. So that means we are rich enough in our clinical load, the patient suffering. And so this aspect is important as regard education and research is concerned, right? But what we are lacking into system, right? So that means we have to, there is a lot of development in last 1 decade, 2 decades, but we have to create a credibility globally so that our research, and I must say our NMC is working for it, ICMR is working for it, ICMR is trying to create various research centers in medical colleges, and things are improving.
Yes, sir. So Dr. Agarwal makes a very valid point which opens up the session for our other panelists, is that we are a diverse country, more people, lot of suffering, which from a research standpoint is an opportunity to publish diverse kind of data and create more diverse research. But as clinicians who see so many patients in a day in a country like India, for him to record and then reach to the last lag of publishing is a big challenge. And I'm going to put up this question around challenge to 2 diverse panelists. First to Dr. Raju Vaishya, sir, because sir, you are a clinician and a researcher, and you must be publishing so much research in reputed journals. So what are the challenges you encountered, and how can researchers mitigate them? And then I would have the thought and a perspective from Dr. Naren on the same. So
Before I answer your question, let me continue with what Dr. Agarwal said. It is a known fact that 90% of the currently published literature or research comes from countries which have 10% population of the world. So 90% of the rest of the world apply the outcomes of those research to their patient, whether it is affordable or not, whether it is applicable or not. And hence it is very important that this 90% underprivileged countries should do more research to find cost-effective solution. And if I go further, South is less privileged than North. So there is a divide between North of the world than the South of the world. So this disparity must be addressed, as Dr. Agarwal said. Now coming to your question, as a clinician, the biggest challenge is your mindset. Most clinicians feel that they don't have time. It is not their cup of tea, especially in private practice, because it doesn't give you any additional bonus as far as practice is concerned. So time constraint and balancing clinical practice and research is a challenge. I would not say challenge, but a mindset. Because if I can do it, other people can also do it. They don't even try. Second is a lack of formal research training. Most doctors in our generation or from our generation were never trained about research, never even told about what is research, except for thesis, which was compulsion and was done somehow, copy-paste mostly. Thirdly, a language barrier. We think in our regional language like Hindi and want to write in English. So we are not as good, and our meaningful research is not taken seriously by good journals, and hence we lack publishing our research in high impact journals, and we end up publishing in either predatory journals or journals with low impact. So our research is not well known. Lastly, I would say we lack funding, as Dr. Prem Agarwal said. Government has so far not intense focus on research, and also we have very few international collaboration which needs to be developed to enhance research from India.
Sure. So you brought out some interesting points. There are cultural factors. There's everyone has a very vast clinical practice, and there is ground level awareness from medical colleges to become a clinician and then a researcher or not a researcher. But the last point that you brought about gets me to come to Dr. Naren on international collaboration. And what do you think about the most common obstacles that researchers face to get their work published in high repute journals?
Thank you, Jigar, right? Liver, right?
Yes.
Thank you. First of all, I would like to thank the organizers of this event, especially Dr. Prem Agarwal, Meghna, for inviting me over to this session. And my regards to Dr. A.K. Agarwal. And a clinician we used to call, he can sniff out a diagnosis, right? So coming to your question, the obstacles that researchers are facing, I would like to frame it this way, that the research ecosystem, especially in biomedical research or medical research, it is improving. It has really improved a lot in the last 10-15 years. So has the number of papers that are being submitted to journals across the world, as well as the total number of publications that are appearing. We now are number 3 in the world as far as Scopus Index is concerned in terms of published papers, and a large chunk of these papers belong to biomedical research. At the same time, what we see is that the focus still is on sound research. And when you say that what can we do to publish in more influential journal or high impact journals, then we have to move towards significance. And that happens gradually, and there are a lot of factors that would drive that. Research funding, training, what kind of research is being conducted. There are so many factors, and I don't need to share those here. They would know more about the research ecosystem in medicine in India better than me any day. And these obstacles, I think, are kind of gradually improving. It's a slow journey. Nothing is going to happen overnight. And funding is extremely, extremely important to be able to publish impactful research in high impact journals.
Thank you, Dr. Naren. So we do have some big obstacles. They are pertaining to funding, and then from what Dr. Naren says, I think it's a journey. It's going to be a learning curve. We will progress slowly. But again, I would like to point out the next question to Dr. Gitika, and Dr. Raju Aisha had pointed this out, that when Indian clinicians have an inertia and they want their research to be published quickly, so all researchers, both young and old, they get duped with fake or predatory journals. And can you highlight what should a researcher keep in mind? Because sometimes these journals have really jazzy names. So is there like a checklist that a researcher can follow?
Thank you for the question. And my regards to everybody who's facilitated me being here. And a very good morning to you, sir, Dr. Agarwal. So yes, the predatory. So the concept of predatory, suddenly appeared in the early 2000s when the focus shifted from very, very focused and good research to just publish or perish phenomena. So people had to publish, otherwise they would lose their credibilities as researchers. So this concept came into the world: you either publish or you perish completely as a researcher. So there was a huge pressure on researchers to publish and publish fast. And that's where the problem of predation happened. Predation or predatory journals, there is actually really no checklist, but there are characteristics. So if you see that a journal is not doing its review process properly, it's very short, or there is not enough impetus on the science part, or it has a name which sounds like another very popular journal, then all these kind of symptoms, I would call, because predation is more like a disease. So all these symptoms are clearly indicating towards a predatory set of journals. So we need to not really remove the predatory journals, I think, but mostly we need to focus on the concept.
Okay. Yeah. Sure. Thank you. Thank you so much, Dr. Gitika. Just before I move to Dr. Sunny, I would like to just quickly come back to Dr. Naren, because I think one of the major reasons why a lot of researchers go and end up in predatory journals is they wanted quick publishing. So would you just like to break a myth? Is like the high credential journals, do they have a very high turnaround time? I know it's a very broad umbrella question, but is there an opportunity for researchers to understand that if you do your checklist properly, even a high credential journal can publish in a certain window of time, like 3 months or 4 months or something like that? Is there a window of duration?
That's a tricky and good question. Let me put it this way, that any journal that has got a very robust, very strong peer review process in place, there is going to be a little longer turnaround time.
Right.
And predatory journals have always had the advantage that you can get the whole paper reviewed in 6 days, 10 days and publish within a month's time. That is certainly not happening with the regular mainstream high impact journals.
Yes. Okay. So, yes.
Can I add a sentence here?
Yeah.
So the thing is that big publishers like, the big ones like Wolters Kluwer, for instance, or Elsevier or Springer Nature, they have come to a stage where they are saying that within the first 1 week, they would give you at least whether your journal is going into the review process or not.
Okay.
This is also an additional benefit because this ensures that you follow the right route.
Yes. So thank you, Dr. Gitika, for adding there. So I'll just move on. As you know, we are looking to publish more and more research. The researchers will also need access to existing research, where I would like to ask this question to Sunny, who's doing a lot of work in the open access movement. So, Sunny, what is your perspective on the open access movement and how does it impact medical research publications in India?
Thanks, Dr. Jigar, for the question, and thank you, Dr. Prem and Meghna, for this opportunity. It's a matter of huge honor to share the dais with a legend like Dr. Agrawal and the eminent personalities from this field. See, open access publishing is the way to go. It is the norm. It is the a movement that the country, and not only India, but the entire world is seeing. Subscription-based publication would be there, but it is what open access publishing, which is the future of medical research. Now imagine a situation, a medical student, an MD student is running to attend his viva, or a practicing clinician is going to the OT to perform a surgery, and all of a sudden they want something to add to what they are going to do or say, either in the clinical setting or in the academic setting. And they open up, try to search and open up with something in their smartphone, and all of it. And if they find that they have to pay something to read that, that is not what is going to help the situation. On the other hand, if they open the link and they read, and that adds to what they are going to do in their academic setting or in the clinical setting, that is what is going to potentially help it. So open access publishing is the way to go. And as we manage different open access journals, be it a new journal which just started with volume 1, issue 1 in 2024, or it's an established journal like Indian Journal of Medical Research, it is the dissemination of the quality clinical content which should be instantly accessible to any reader, any individual sitting in any nooks and corner of the globe. And that is the way to go ahead. And that is what we are contributing. Publishers like Scientific Scholar is contributing with their motivation to help students, researchers reach the pinnacle of their career and take medical research forward.
Indeed, I think accessibility is very important in a country like us. Thank you. Thank you, Dr. Sunny. I would like to quickly go back to Dr. Narain. You have experience with publishing and managing both journals and books. Would you like to guide our delegates on which channel to choose and what are the challenges in both of them and how to position between these two forms, books, journals? And also I would like to just quickly put out, in the interest of time, is what are the digital trends emerging in publishing?
Okay, so let me tackle the second question first.
Sure.
And the first question is actually a curveball, but still.
Okay.
So if I were to quickly look at the trends that we are witnessing in scholarly publishing or scientific publishing, that pertains mostly to journals, open access movement is the first one. That is rapidly evolving, and in our company by end of this year, probably 50% of the papers would be published in open access. All right, that is really catching up. Second one would be the use of artificial intelligence in the entire journey and experience of an author, from the time of submitting the paper to the time it is published. All the major publishers in the world are deploying AI or large language models or machine learning to expedite the entire process of publishing as well, which means it also plays a crucial role in the peer review process. All right. This is the third point, that the peer review process is also improving. And now journal societies, they're also experimenting with post-publication reviews or open reviews. And we are not merely confining ourselves to just single blind or double blind peer review processes. That is also rapidly improving. However, there are some other markers which I should touch upon. One is the so-called DEI, diversity, equity, and inclusion. We have seen that major journals in the world, they have kind of Western heavy editorial board members. So that is changing, and we are now seeing that a lot more editorial members and editors-in-chiefs to journals are being appointed from the emerging regions. We also see a bit of a gender inequity that is also changing quite a bit. I also see emergence of a lot of interdisciplinary topics that are going to be covered in journals as well as in books. That is also rapidly improving. And we also see that so-called editorial bias which we feel sitting here in the emerging regions, that is also something the publishers are looking at and see how that can also be eliminated. That is one. Second, books. I will be quick there that are books going to be relevant? Yes, books are going to stay around. They are not going away. The reasons are several. Books are providing you at a scholarly level secondary information. It is not primary research that is the purpose of books. It is secondary information. Imagine a book in medicine that has got 1,000, 2,000 references in it. So you have got or gathered the collective information of those 2,000 papers in that book itself. So books have a huge bibliographic relevance. They of course have a huge educational purpose. Core textbooks, you can never learn from journals or research papers. You would always require core textbooks at any level for conceptual understanding. All right? And then it's also a legacy issue. Have you seen an author putting the copy of his research paper in the back shelf? You will always find that he will keep a copy of the book that he has written or edited. So it has got that project immortality concept to it also. So books will always stay is how I would again close my arguments.
Thank you, Dr. Naren, for putting out a lot of crisp points. I just have last one question. To Dr. Sunny, what is the biggest challenge that any new medical journal or its affiliated society faces originating from India in today's competitive publishing arena?
So that's an excellent question, Dr. Jigar. We do publish a lot of new journals at Scientific Scholar, and what we see that the medical societies, the biggest challenge and their sole motivation is to get the recognition from NMC. And to get the recognition from NMC, they need to be recognized with major bibliographic portals like PubMed Central, Scopus, Clarivate's ESCI or SCIE. And to get recognized with these major indexing portals, they need to publish a high quality content. So they enter into a vicious cycle of whether the egg came first or the hen, because without the good quality content, they won't get recognized in these major bibliographic portals. We're getting selected these days is pretty challenging and tough. So for the first 3 to 4 years, this is the major challenge that they face. And also the challenge they face is how the publisher is treating them, how they are guiding them to move forward and ensure that ethical considerations are held at supreme. And if they can maintain the ethical standards and at the same time commission high quality content and contribute to the already existing clinical information, which is the major challenge, they are going to get success. Thank you.
Thank you, Dr. Sunny. So I think you've covered a good spectrum, and it would, because here we have a group of achievers today for the medical research, I think it will be appropriate for me to take the final words from Dr. Raju Vaishya and then the chairperson. So you've been a medical researcher and you've been recognized by Stanford for your for being on the top. Sir, a lot of delegates and achievers today, they aspire to become that. What are your top 3 messages for them that will help them in such a journey to achieve closer to where you are? And then I'll hand over to the chairperson to conclude the key message from this session. Yes, thank you.
The most important thing is that if you do a research and if you do not publish it, it is a waste, because publication of a research is the final end point and it must be done. And if you publish it, try to publish it in a higher impact journal rather than a lower impact or a predatory journal. And for this, you require formal training in research. You should have good mentor and preferably good collaboration, international or national, so that you have a wider perspective.
Thank you so much, and thank you so much to all the panelists for all the insights. I'll request our chairperson to put out the final words for this session.
Thank you, our moderator, for a wonderful moderation. I'm glad that our chief guest Ramesh ji is taking so much interest, and normally chief guest leaves after the inauguration, but thank you very much for being with us. So I just want to give 2-3 messages, which is very important, and after listening to all of you and my colleagues. Initially, when I was medical student and perhaps in the early phase of medical profession, we used to hear publish and perish, publish or perish. But later on, this dialogue became redundant. You need not to publish only, you have to bring out the quality publications, high impact publications. Forget about that you are feeling, unfortunately still that trend is going on कि NMC ने कह दिया 2 पेपर होने चाहिए तो बस हमने लिख दिए जो लिखना है. That is the worst thing happening in our profession. Now the publication, the research work has to be oriented towards innovation. Ramesh ji, हमको अपने right from undergraduate students to postgraduate students, जब हम देखते हैं IITs में बच्चे स्टार्टअप शुरू कर रहे हैं, और वो तो that is a success story for us. Why can't we bring that success story, Prem ji, for our medical students? I should have done it when I was Dean Ma'am से, लेकिन अकल बाद में आई. And of course, as we said, we have quantum of the clinical knowledge. Registry, I always say, bring registry on the surface. राजू वैश्य साहब से मैं कहता हूँ, आप अपोलो में ऑर्थोपेडिक सर्जन है, पैन अपोलो कितना बड़ा नंबर फुटफॉल्स है. यदि आप एक जॉइंट की किसी एस्पेक्ट को लेके पैन अपोलो का ले लेंगे तो कितना बड़ा नंबर्स आप दुनिया को देंगे. फॉरगेट अबाउट इंडिया. द एंटायर वर्ल्ड इज लुकिंग टुवर्ड्स अस इन मेनी फील्ड, व्हाई नॉट इन मेडिकल रिसर्च. तो वी हैव टू क्रिएट रजिस्ट्री, पब्लिक पब्लिकेशन हाउस, एसोसिएशंस, इन सब का एक ही रोल होना चाहिए कि कोई पर्टिकुलर फोकस को लेके एक रजिस्ट्री क्रिएट करें. कोविड ने भी हमको ये लर्निंग दी है. एंड नीडलेस टू से दैट वी मस्ट कंसंट्रेट ऑन स्टार्टअप राइट फ्रॉम द यंगर एज. आवर यंगस्टर आर सुपर. मैं ये कहना चाहता हूँ कि मेरा मेडिकल स्टूडेंट जो है इतना इंटेलिजेंट है, यू कांट इमेजिन. पीजी तक आने तो वो बहुत ही, और उसको केवल एक राइट चैनल की ज़रूरत है. केवल हमको ये नहीं कि उसको क्लिनिकल साइड में लगाए रखें, उसको शुरू से ही हम अपने पब्लिक और इंसेंटिवाइज होना चाहिए उसका. फिर देखिए पब्लिकेशन हाउस जो हैं फ्लडेड होंगे आपके हैं. आप कहेंगे साहब not only the Indian scenario, the global scenario, because they are looking into transparency, they are looking into solid data. So we are rich in data that has to be utilized. Thank you very much, my dear moderator.
Thank you. Thank you, sir. And over the session.
एक मिनट. डीन साहब तो हमारे इंस्पिरेशन रहे हैं. मैं भी स्टूडेंट रहा इनका. तब तो डिफर करने की हिम्मत नहीं थी. आज कह देता हूँ. सर, व्हाट इज मोर इम्पॉर्टेंट टू माई माइंड, आई डिड माई एमडी इन थीसिस, एमडी की थीसिस करी और मैंने 15 जगह भेजी पेपर बनाकर, सब ने रिजेक्ट कर दिया और मुझे कह दिया कि तू रिसर्चर नहीं है. मेरी हिम्मत टूट गई. मैं डेजिग्नेटेड नॉन रिसर्चर हो गया, क्योंकि जहाँ मैंने भेजी थी वो इतने बड़े बड़े लोग थे. उनको कहाँ मैं compete करता, कौन सा पीयर ग्रुप compete करता. तो मेरा कहना तो ये होगा आज के दिन सर कि क्वालिटी रिसर्च विल कम आउट ओनली व्हेन आई बिकम ए रिसर्चर. पहले मुझे रिसर्चर बनना पड़ेगा, फिर मैं बेटर रिसर्चर बनूंगा, फिर मैं क्वालिटी रिसर्चर बनूंगा. तो मेरी आदत जो है वो एमडी थीसिस छापने से ही शुरू हो जाएगी. मेरी एमडी थीसिस छपी थी, और कहाँ छपी थी? नरेंद्र तो लेगा नहीं, कोई भी नहीं लेगा. ओपन एक्सेस वाले भी शायद ले लेंगे, लेकिन मैं फिर आपसे कह रहा हूँ एक जगह है जो जरूर लेगी, वो है मेडिकल डायलॉग. मेडिकल डायलॉग आपकी रिसर्च को एज ए रिसर्च नहीं छाप सकेगी, क्योंकि आपका फ्यूचर रिसर्च का छपने का खराब ना हो जाए. हम एज ए न्यूज़ छाप देते हैं. We want to publish every effort of research as a news, but as much in a paper as a research paper could have been. अच्छा, दूसरी बात क्या है कि हमारा पेपर जो है गूगल सपोर्टेड है. जो आपने हमारे पेपर में लिख दिया वो गूगल टाइप करोगे तो आएगा, उतना ही आएगा कि स्प्रिंगर का आएगा. बराबर का लेवल है सर. हमारा छपा हुआ भी आपका चाहे अच्छा है चाहे बुरा है, लेकिन आपको वही स्टेटस देगा जो स्टेटस लांसेट का आएगा कि लांसेट में छपा था तो मेडिकल डायलॉग में छपा था, क्योंकि छपने का न्यूज़ है और एक आपकी रिसर्च पेपर है. तो हम लोगों ने कोशिश करके हम ये प्लान कर रहे हैं कि हिंदुस्तान के हर एमडी स्टूडेंट्स का थीसिस should be converted into a paper, should be published at somewhere at least, and that is, of course, medical dialogue is there. We don't say no to any research paper coming in the form of paper, news. And then, after that, when it is published, it can always be republished as a paper, because it is only a news that it is a news has been done into open access or even to better place. Your option open. So this is what is very important, that we have to create researchers, sir. If we create researchers, only then we create good researchers. And first thing is that we have got so many PG students across the country, national board, and one more thing I would say, part of my chair moderator is looking at me, that research funding government देगी. हर आदमी मुझसे कहता है फंडिंग कहाँ से आएगी यार, फंडिंग कहाँ से आएगी, हम देंगे फंडिंग, आप खुद करेंगे फंडिंग. You don't need funding to research. You need attitude. Attitude of collecting data. अभी मैंने अपने अस्पताल में 10,000 पुलिस वालों का मेडिकल किया और सारा डाटा कूड़े पड़ा हुआ है. I don't have attitude to put it into right spirit and analyze it. So for that you don't need any funding. So funding जिस दिन private institutions खुद करना शुरू कर देंगी, जिस दिन हम अपने डाटा को एनालाइज करना शुरू कर देंगे, उस दिन हम सारे रिसर्चर बन जाएंगे. And I think this is the message which I would like to give it, that do it, publish it anywhere. अपने हॉस्पिटल के इंटरनल जर्नल में ही पब्लिश कर दें, लेकिन पब्लिश जरूर करें. डोंट एक्सपेक्ट दैट ये हाई लेवल लांसेट में छपेगा, अमेरिकन हार्ट जर्नल में छपेगा. तब आप शुरू में छापना शुरू कर देंगे तो बाद में भी छपेगा. थैंक यू सर. थैंक यू. आइए. I thank all the please. I thank please.
Just one quick comment that we are looking at two kinds of papers or research. One is a significant novel research and another is sound research. What we are witnessing now is that the high impact journals, popular journals that have been established for decades, they are publishing significant journal research. So they have a higher screening level, quality criteria. But now there is a large base of sound science journals where as long as your methodology is correct, your results are fine, it has been done in an ethical manner, you can publish it and publish it in open access. So what probably Dr. Prem was referring to was a paper that was rejected by high impact journals. He was trying to publish it in Lancet, not happening. And now and most likely it was sound science research that you conducted, and nowadays there are multiple options for all the researchers to publish their sound science research in some journal or the other. Thank you.
Very good.
Thank you very much, Professor Agarwal, Dr. Dattani, and all the panelists for fostering such a thought-provoking discussion. I'll now request the chairperson to hand over mementos. First to Dr. Raju Vaishya. Dr. Sunny Datta Gupta. Dr. Geetika Serene. Dr. Naren Agarwal, Geetika Siri. I'll request Dr. Prem Agarwal to kindly come over and hand over memento to chairperson. Ladies and gentlemen, please give them a big hand. I'll request chairperson and Dr. Prem Agarwal to hand over memento to Dr. Jigar Ditani. Ladies and gentlemen, now we move on to our next panel discussion. The topic is Horizon of Medical Research, Emerging Trends and Future Directions. I'll like to invite chairperson of the session, Padma Shri Dr. Yash Gulati, session moderator, Dr. Dharmesh Lal, Dr. Rajendra Gupta, Dr. Vijay Agarwal, Dr. Saurabh Sharma, Dr. Dinesh Verma, and Dr. Sunita Varman to kindly come out to dais. All the panelists, please.
Please.
Ladies and gentlemen, Chairperson Dr. Yash Gulati is a senior consultant orthopedic surgeon at IP Apollo Hospital, New Delhi, with 35 years of experience in joint replacement and spine surgery. He is also a recipient of Dr. B.C. Roy National Award. Session moderator Dr. Dharmesh Lal is a senior scientist at ICMR. He has made significant contributions to various research projects at ICMR, particularly in areas of descriptive research. Among our panelists, Dr. Rajendra Gupta is a renowned health policy expert who has contributed significantly to health policy, digital health innovation, and community health initiatives. He is also founder of Viksit Bharat Abhiyan, Project Create, Health Parliament, and Academy of Digital Health Sciences. Dr. Vijay Agarwal, my senior from MAMC, is a distinguished pediatrician who has played a key role in Pulse Polio program. As founder chairman of the Nursing Home Forum of Delhi Medical Association, he shaped the biomedical waste rules. He also founded and nurtured CAHO, transforming it into an academic institution for patient safety. Dr. Saurabh Sharma is a leading expert at Clinton Health Access Initiative. Sorry, Saurabh could not come. Dr. Saurabh Sharma, we'll wait. Dr. Dinesh Verma, a seasoned ophthalmologist and AI expert, is the founder of I4 Vision Diagnostics. He is instrumental in development of personal ophthalmic diagnostic system and Drumfries Visionostics. Dr. Sunita Verma is Group Head R&D at Center for Development of Advanced Computing CDAC and Head of Medical Electronics and Health Informatics at Ministry of Electronics and IT. She has made significant contributions to the advancement of electronics and IT research. I'll now request Dr. Dharmesh Lal to kindly take charge and moderate the panel discussion. Dr. Dharmesh Lal.
Am I audible? Yes. So, heartiest welcome to all the distinguished panelists, as introduced by our colleague. So, I would like to start with Dr. Rajendra Gupta, who has been working a lot in digital health and has been one of the pioneers in the country. So, Dr. Rajendra Gupta, I would like to initiate discussion asking you to throw some light how the digital health is transforming the medical research, and what do you see the future direction as far as the possibilities of digital health is concerned affecting the health scenario.
Thank you, sir, for this opportunity. Firstly, I congratulate Dr. Prem Agrawal. What I loved about his starting this is he laid bare hard facts, which very rarely people speak on such forums. And I also want to share an anecdote on research. This is very close to me. As an author of 5 books, I am a researcher at heart. So when I was serving advisor to the health minister, we have a library called NML. I think Srini is going to speak in the afternoon, who has the additional director charge for that. They were always, I would not say denied, but devoid of funds. So someone told him to come and meet me, and when he met me, I asked Naddaji that let's review NML. A minister never reviews a library as such. So myself, Mr. Nadda and Mr. Dr. KP Singh, who was director, we reviewed. And I said, sir, let's give him whatever money he asks, because 5% institutions do 95% research. It's not possible to access journals. I still remember he asked for 27 crores, and Naddaji looked at me and said, Rajan, what to do? I said, sir, de dete hai. So we issued 27 crores. Not only that, I asked him to write a note that should be put on the landing page of the NML. So I think at that time we invested a lot on NML, and that's very important. Now coming to the question of digital health. I have a quote that I will still repeat, that if you're not in digital health, you're not in healthcare. That's a fact. But what has happened now for researcher is that medical science is driven by data science. It's not the other way around. And I don't know how many of you have a phone or a health app on the phone or using a smartwatch. Can you raise your hands? So just by default, they are subjects of medical research. Their data is with their provider. So I think most of the populations are by default a subject of research. Now question is, who is doing that research? But what I find interesting is the way we do research has changed. The dimensions of data, the longitudinal data, and more than that, what we called as real world data and live data. I think COVID gave us a proof that we could come out with a vaccine in less than a year's time, which is typically a 15-year process. So I think we have the latest evidence of what can be done with digital tools. Repurposed drugs during COVID were thanks to AI. So I think when I look at it, 3 things will change. One is data, second is AI machine learning, and the third is cloud. Because at the end of the day, it doesn't matter where you are. If we are on cloud, we are still collaborators. I think this will change the definition and direction of research, what we call it. So I'm very enthused at what digital health is doing, and still who are late adopters are actually like, I think adopt or perish is what I would call. Thank you.
Yeah. So very well summed up, Dr. Gupta, the way digital health has been affecting the medical field and largely the population as such. I do remember that, as you mentioned about the vaccine part, that Pfizer during COVID-19 was the pioneer to use AI. And they used the platform wonderfully to come out the vaccine in no time. And AI, has been, in particular, has been playing a big role in prediction also. And now people have started talking of even precision medicine at individual level also. So we could see a scenario in future where we have individualized data analysis and care, customized care. So now I move on to Dr. Dinesh, sir. He has been pioneer in himself. So, sir, I would like to know what are the latest advancements, sir, in relation to AI, just to continue what Dr. Gupta said, sir.
So AI, as we all know, used to be called artificial intelligence. Now people don't like to use the word artificial because there's nothing artificial about it. It is augmented intelligence. And I have been doing a lecture, public lecture, since 2018. I think the first one I did was in India Habitat Center. And the title was A World Without Doctors. But it was a provocative title, and I would add the subtitle, There is going to be a world without doctors who don't work with AI. So I think that is the core message. Coming to your specific question, what is happening? Radiology has been in the forefront for AI because it's an image-based specialty, and AI pattern recognition is very easy to do in a digital image. And now with machine learning, the computer learns itself. The algorithm is written initially, and then it learns its own mistakes and corrects the mistakes. So many of the research which was done from late 90s, 1990s, 2000, until about 2017, 18, the radiologists were performing better than the machines. 2018, the graph cross. There's a very good article in Nature which has shown that graph. And now the AI is significantly better in many fields. It's not that they can do everything. And I think that's the fear that most doctors have, oh, AI is going to take over. No, it's not. AI is like a co-pilot. So it will help you, and especially when there is a repetitive work, that something is, for a human being, it's boring because you keep doing the same thing again and again and again and you do mistakes. For AI, that's not a problem. So things like screening for the breast cancers. My specialty, ophthalmology, was probably the second one coming into this. And there are so many programs now. Google's DeepMind started a program in 2014 involving Moorfields Eye Hospital's 20 top ophthalmologists. Moorfields is one of the most reputed hospitals. And DeepMind on one side was looking at the retinal images and OCT, the optical coherent tomography. And on the other side were 20 ophthalmologists without knowing who is doing it, so like a double-blind trial. And the first result showed that the AI matched exactly what the ophthalmologists were doing. And after 2 years, they looked at the same data again, same patients, and what has happened to them 2 years later, and AI performed better than the ophthalmologists. So what AI had predicted was they turned out to be right, the doctors were wrong. So ophthalmology is an area, and just last month, FDA has approved one of the first software programs, algorithms, AI-based, for diabetic retinopathy screening. As Dr. S.V. Madhu mentioned, diabetes is a real challenge, and screening for diabetic retinopathy is a huge challenge, especially for India. With the manpower that we have, we cannot cope with doing real effective screening. So this software looks at the retinal image, and it is giving a diagnosis with the grading. And I'm very proud to say that I was involved in this research in 2003 when I was working at Doheny Eye Institute. And at that time, the digital imaging had just started. And we had a challenge that who is going to look at all these images, because ophthalmologists are busy doing their surgery and looking at patients. So what we did was we took some school leavers, people who have just come out of school, no medical training, and we taught them to look at images and just put in an algorithm, which I had written with my software team, to say whether they can see yellow spots in which quadrant, right? Red spots, which quadrant. As simple as that. and the algorithm produced an international classification of diabetic retinopathy based on those things. So that was first semi-automated diabetic screening tool. And now, obviously, it has reached this stage. So ophthalmology is one, and one company, as I said, I think it's called Luminetics Core. It's a Toronto-based company, and FDA has approved, and they have a coding, because in America, and even now in India with the insurance companies, coding is very important. Other fields, medical records, already been mentioned about digital health. Now you can dictate not just a letter, but anything about patient's history, and it converts itself into a proper record. So that is all automated. Other fields are cancer research, not research, cancer treatment. So there are software which are looking at the brain scan images, and they calculate the contours of the brain tumor or whatever lesion there is, and the surgeon can see all those images during the surgery, and with the help of robotic surgery, they can do a very, very precise job. Gastroenterology, again, there are programs for polyps to recognize using AI, and they're much more accurate than what the doctors were doing. So these are the fields which are coming up in recent years.
Wonderful. So we saw the bundle of opportunities and possibilities as far as the AI is concerned. I think if I were to sum up the usability and applicability of AI is that one is the precision, which was never seen earlier with any of the modalities we have been using, at least in the medical field. That is one. The other thing is that the magnitude the AI can handle. The big data analytics is a big thing for AI use. I have been seeing and reviewing a lot of papers coming from all over the globe as reviewers of our many journals, that people have been just using some data and they have been predicting big thing through using AI, particularly the machine learning, as you mentioned, and Dr. Gupta also mentioned about the machine learning. So these are the two things I think which AI has added. And of course, I concur with Dr. Verma that radiology has been, doing mesmerizing as far as the AI applicability is concerned. I think a lot of contribution for AI is coming towards radiology. And I am glad to share with the audience here that ICMR has been funding a lot of studies on this. And we have been trying to validate the applications of AI in diagnosing, particularly the radiological features like for tuberculosis and other diseases. And we hope that we are able to do the validation, and then we recommend to the government to be part of our national health programs. So I move on. Then I would like to request Dr. Vijay sir, that how the hospitals and healthcare organizations, sir, contribute more effectively or can contribute more effectively to medical research. And what are the emerging areas, sir, do you foresee and you could see the possibilities of the collaboration?
Thank you, sir. I think the most important emerging area, first of all, let us understand what a century of medical advances it has been, and that has been because of research, whether it was introduction of antibiotics like penicillin by Alexander Fleming, or vaccines, or let's talk about robotic surgery, or you talk about the advances in cardiac care, ophthalmology care, cancer treatment, HIV, AIDS. So this should have been a golden era for the medical science, for the medical professionals. Unfortunately, if you ask, is it the golden era? The answer is no. Because I think the focus of our research has to shift now to the healthcare delivery. And that's where the institutions, the healthcare, that is where the healthcare delivery is happening. And let's understand that in a country like United States, where they are spending the GDP of our country, equivalent to the GDP of our country on their healthcare, there, the preventable medical errors are the third leading cause of death in that country. So much so that, the estimates are more than 200,000 Americans are dying because of preventable medical errors in the hospitals every year. And therefore, this is an area, And their accreditation bodies have been in existence for last 80 years as compared to, let us say, our NABH or something which has been there now only for 18 years. It is kind of bringing very clearly that merely accreditation is not going to change it, because we have not tried to focus on research as to how to prevent medical errors and things of that kind. And that's where everything, lot of things. So recently, for example, if you take artificial intelligence, now one of the robotic things that you see in the hospitals, that the nurses taking pulse and blood pressure after every 4 hours. They do it sometimes, again, the task is so boring, sometimes they don't do it, it is being copied. And it is seen that nurse has taken, let us say at 8 a.m., the patient has developed a code blue 15 or 20 minutes later. So now there are kind of innovations that are coming, which is giving the data on the pulse, respiration, blood pressure of the patient continuously. And therefore that data is now can be communicated to the clinicians also in time, and therefore saving huge amount of precious lives. So I think the hospitals, like in the past, in the previous sessions also it has been said, first is that I think in our medical curriculum, we need to include a topic to sensitize the graduates about the importance of medical research. It is also to, I would say, emphasize to the hospital owners and the clinicians about the importance of medical research. In fact, nowadays, a lot of people come with different kind of, some vendors will come. Recently, I bring you, let's say, greetings also from this organization that we have created called CAHO, which is the Consortium of Accredited Healthcare Organizations. And our focus is exactly on only promoting patient safety and quality, and to take the hospitals beyond accreditation. So for example, now somebody came and said they are using games to provide education to the nurses, to the doctors, but games as a medium. So we are now trying to test out those games in some of the hospitals. It will be taken as a research. That is your claim. But let us see what kind of an impact that particular modality. So I think the scope to do research in the hospitals is huge. And especially I'll say the focus has to be more on the healthcare delivery, which should lead to safer care, because otherwise, in spite of huge advances in the medical care, we have reached a stage where I think one is becoming afraid, because I think the patient safety and professional safety are directly interlinked. So the amount of professional violence, the litigation, all that is linked to our not focusing on safer care. Thank you.
Yes, very pertinent points Dr. Verma has highlighted. That I perfectly completely agree with you as far as the reduction of medical errors are concerned in medical care delivery. And I must share here with all the audience here that we have hardly any data, or at least on the national level, as far as the medical errors are concerned in Indian context. So first of all, we need to begin somewhere to have this data as a nationwide study, so that we have some kind of information what burden of medical errors we have in India. And second point which you raised is that once we have AI in place and with all the standardized protocols, this will definitely lead to reduction of medical errors. But still, we have a long way to go, that we have a scenario, futuristic scenario, we have AI in place, all the standard protocols are there, and then we do the healthcare delivery system accordingly. So, but we do foresee that situation to come up very soon. And third point is, you talked about medical research by the private sector. ICMR has been getting thousands of proposals from across the country. 2 months back, we got around 10,000 proposals from the country. And almost all the proposals, I don't remember even 10 proposals coming from the private sector. So we do look forward to private sector to be part of this medical research and come forward, because around 70% of the medical care approximately is being given by the private sector. And we do understand in ICMR also that they do also need to have some capacity building for conducting medical research also. So very well points, very well taken points, Dr. Verma. And now I move on to Madam Dr. Sunita Verma.
We are not related, just in case somebody accuses of hypocrisy and nepotism.
Yes. I should have said that, I think. So now, ma'am, as a group head R&D in the Ministry of Electronics and IT, what message would you like to give to the audience regarding the latest advancement in medical field and how the government and particularly your department could facilitate that, ma'am?
Okay, thank you. First of all, I would like to thank Dr. Prem Agarwal for inviting me here in this session. This was more of a knowledge gaining from me as a non-medico year from the electronics engineering side than from the medical side. But the panelists before me and here also have been talking about AI and the interventions of ICT in the medical field, because now you cannot think of any medical diagnostics, predictions or interventions without the electronics or IT or the devices. We talk about precision, we talk about predictions, we talk about analysis with the AI tool. We have number of AI tools. As head of the R&D in the Ministry of Electronics and IT, what we are aiming at is developing our own indigenous solutions. And in AI, if you, we all understand that data is the most important factor for the prediction or precisions. We even talk about personalized health, digital twins, where we look at, the people are looking at, especially I know in diabetes, at least a digital twin of a person to actually have the specific diagnostic and treatment. And this is possible with the tools and the data about that person. There are globally tools available, but for the Indian demographic system, it is the Indian data which is very important. There are globally companies which are coming to the country, taking the data, developing tools. It is the time where we have to develop our own tools using our own data, because the data of the Indian origin people, and also it's not only Indian origin, we are doing research based on maybe northeast specific population or north specific population or South India specific population, so that we get very precision and precise analytical tools. Having said that, our ministry has an AI mission. We are the nodal agency for AI, and healthcare is one of the sectors which has been identified for the AI research, and creating the data repository for the various ministries, including health, is one of the aims that we have. This data repository will be used, after the annotation and sanitization of data for the researchers, so that the Indian demographic data can be used by our researchers for the research and developing tools which are specific for the Indian community or Indian population. So that is a major program that has been recently started, cleared by the cabinet. And I am in charge of the medical electronics and health informatics also in the ministry. So we are having various indigenous measures for developing our own diagnostic and medical equipment. We have recently started with the 1.5 Tesla MRI, the linear accelerator for radiotherapy treatment, ultrasonography machine, blood irradiator system. Then we have service scan systems. So it is an import substitution that we are looking at, and the funding is done by our ministry. I have a kitty of around 1200 crores. Somebody was saying that we are short of research funds. ICMR is funding, DBT, Department of Biotechnology, Ministry of Health. We are working in sync with all of these ministries for funding. So my own funding is around 1200 crores per year annually for research, which includes medical research. So there is no dearth of funding. It is the coming out with the right application or the solution to the problem statements that are seen is what is important. And I think that we need to do that. So I have a lot to say, but I think in the interest of time and for other panelists, I will just stop here. Thank you.
So you also underlined and concurred that, yes, we do need to have first data. And I think data must come on not only from the government institution, but from the private sector also. Because as I said, 70% of the care is from the private sector. So until and unless we have data from private sector also, then it becomes very difficult to use AI for prediction and analysis and do other things from AI. That is the one thing. And it is very encouraging that, madam, even your department is coming forward and has been facilitating a lot, even AI research. And I definitely see a scenario where I think in next decade or so, India will be definitely the leader in the AI for health delivery system. So as in the interest of time, now I would like to request Dr. Yash Gulati to sum up the session and move forward. Thank you, sir.
Thank you, Prem, for inviting me here. In the interest of time, I will be brief. Our country is the most populous country in the world, and we have the topmost expertise in medical field, and we are the global hub for pharmaceutical. Yet, the research coming from our country is not as good in numbers or quality as it should be. But the future, listening to all the ladies and gentlemen here, doesn't look so bleak, because we can see that we are going to imbibe artificial intelligence, we are going to imbibe technology, electronics, and as Vijay sir said, that we are going to now also concentrate on delivery system. As we heard in Alice in Wonderland, that we have to run to be able to stand. And as Dinesh said, that if we do not imbibe what he called augmented intelligence, we will be nowhere. So I can see that the future is bright. We need to collaborate. There is need for collaboration. My own daughter, for example, in her contract in US is written that 70% clinical, 30% research. So we have to incentivize research. And once this happens, then only quality work will come out. And many people in US get their salaries from the funding they get for industry. So this funding from the industry and the government is going to be very, very important. So I see great future, but we have to have good vision, and we need to change our mindset from the servants, providers, service providers to thinkers and innovators. Unless that mindset changes, nothing will come out. So I think the buzzword is we need to change our mindset also. Thank you, ladies and gentlemen. Thank you very much.
Thank you very much, Dr. Gulati, Dr. Dharmesh Lal, and the esteemed panel for such an insightful discussion. I'll now request Dr. Gulati to do the honors. I'll request him to, first of all, give a memento to Dr. Dinesh Verma. Dr. Mrs. Sunita Verma. Dr. Vijay Agarwal, Dr. Dharmesh Lal, and now I'll request Dr. Prem to kindly come over and do the honors to Dr. Yash Gulati. हाँ बोल रहे डॉक्टर जितेंद्र गुप्ता. Put your hands together for such a nice discussion. Ladies and gentlemen, let's have a group photograph.
I will only comment one about the funding. फंडिंग के बारे में इतना ज़्यादा डर है कि फंडिंग कौन करेगा, और वी आर ऑल लुकिंग टुवर्ड्स गवर्नमेंट दैट दे विल फंड. गवर्नमेंट के पास अपने पास फंड करने के लिए बहुत पैसे हैं, मैडम ने भी कहा बहुत पैसे हैं, हर जगह पैसे हैं. पैसे लेना आना चाहिए, जिसको लेना आता है वो ले लेता है, जिसको नहीं लेना चाहता वो नहीं लेता. लेकिन साइमल्टेनियसली मेरा अपना ख्याल है जिस दिन हर इंस्टीट्यूशन अपनी फंडिंग खुद क्रिएट करेगी उस दिन एक रिवॉल्यूशन आ जाएगा. Why can't a hospital himself decide that this particular part is good for funding for the institution research? और उसी दिन हमारा सारा काम पूरा हो जाएगा. ये बात मैं कहता हूँ कि हमें लोगों को कहना चाहिए कि हर इंस्टीट्यूशन ही फंडिंग शुरू करे, अपनी फंडिंग अब खुद करें, किसी और की तरफ ना देखें. थैंक यू वेरी मच.
Ladies and gentlemen, now we move on to the next session. Next session is healthcare industry and clinical research. I'd like to invite Dr. Prem Agarwal to kindly chair this session. I'll also request session moderator Dr. Jigar P. Dattani and panelists Dr. Ashok Kumar Thakkar, Dr. Ashish Indani, Dr. Raja Mannar Thinnati, Mr. Praveen Jain, and Dr. Sunil S. Iyer to kindly join us on stage.
Hello. Thank you, Dr. Kohli. We are under the fourth session on healthcare industry and clinical research. There's been a lot of talk about funding in research, and this session is going to be really exciting because this is a bunch of esteemed, incredible minds. These panelists are a bunch of incredible minds with comprehensively resourceful, and they've done incredible work across different industries, and I'm sure they're going to have a great vision in the coming decade. So all the panelists are here, and we open up the session with Dr. Ashish Indani. So how do you think the medical industry, including pharma, medical devices, biotech, biopharmaceuticals, can contribute to medical research?
Thanks. This is a very nice question, and I have always been advocate of partnering between the research institutes, the government institutes, and the industry. Industry is the integral part of the research. Why? First of all, you do whatever research, but if that research doesn't reach to the common public, that is useless. And industry is the one who actually takes the research in the clinics and labs to actual healthcare. And this is where the vital role of industry comes in. I have a habit of putting everything in the power of 3. So if I speak of research infrastructure, majorly the research infrastructure is provided by industry, which is in terms of formulating the research, framing the research. We heard that in the morning the protocols are missing in many cases. So formulating that research and framing the protocol and all the documents around it, and then also funding the research when it is required. When the research is in the conduct, creating providing the training on various kind of instruments and various kind of products, procedures, all these things, that is provided by the industry. And the last and the most important part, that is about the consumption or the knowledge. So communicating that research and providing that knowledge and taking it all on the ground and incorporating it in the practice, this is what the industry offers as a clinical research to the firm.
Thank you, Dr. Indani. So after a broad, insightful blueprint, we open up this session further ahead with Dr. Thennati Rajamannar. Sir, you come with an incredible experience of more than 250 patents filed and some new INDs filed at the shortest turnaround time. And I think you're probably one of the best persons to answer this question which I ask you. We are really making good generics. We are the pharmacies, India is considered the pharmacy for the world. We are slowly now advancing towards drug development as well. Tell us about your experience, the challenges and opportunities for India in this direction.
It's a very interesting question. Thank you, Dr. Agarwal, to be part of this program today. Wonderful. The most important thing is that we play a significant role in global health. Like in the last 40 years, from 1 billion of revenues to we are about 60 billions. That's the kind of progress we made in terms of pharmaceutical sector. We are good at reverse engineering, making drugs which are known, and making in a way, in a short time, the affordable medicine with quality and with delivery. These are the most important things. You deliver the goods and with quality and affordable cost. It's not only to the India, but it's a global. We supply about 20% of medicines worldwide. But if you talk about the global revenue of the pharma, this thing, it's about 1.6 trillions. And we are talking about 60 billions. We are less than 5%. And we supply about 20% and 40% to US, 30% to Europe, and so on. 60% of, all those things we do that. And when you talk about revenue, it's very insignificant. The kind of efforts which we bring in and the kind of returns which we see is not matching. Where is the gap? The gap is innovation. We need to do innovation. If you say today, what is the drug which is not made in India, the cost? You could have seen that last budget, there are 3 medicines, there is no import duty. But still, each of those medicines would cost about 1 lakh per month, more than 1 lakh. So that's the kind of a cost out of the pocket a patient needs to spend. It's not going to be affordable. When you say that Vikshit Bharat, a developed nation by 2047, and if you don't venture into what is discovery, what is innovation, because we know that we made more than thousands of APIs, drugs, and what is a medicine, how it interacts, biologically what is the role, what is the transport system, what is the drug-drug interaction. All those things we know, but when it comes to making a drug, but it's an art. And many of the companies learned over decades, but we are trying to learn. Is it going to pose a big problem? Yes, it's going to be difficult, but it's not achievable. We can definitely do an innovation. We can create on the world map India like the way that the pharmacy of the world today, we supply most of the medicines. We can also create tomorrow going to be the Make in India drugs available everywhere at an affordable cost, which can cure most of the patients. And that's the kind of I think thinking process we need to change, that simply, reverse engineering, creating things, creating, incremental innovations. I mean, incremental innovations can give a one-time opportunity, but there are drugs, every month sells about 5 billions. That one drugs earn about 60 billions. And that's equivalent to about 2023 revenues of the whole pharma in India, about 3,000 companies. So the kind of knowledge, the kind of skill force, the kind of understanding we have, I think we need to channelize what is drug discovery, how do we invent, what is the process of biology, where it goes, how it talks, what is cancer, what is non-communicable disease, what is diabetes. It's not impossible that we can do that, but it would take time, but once we start, I think we would be able to lead. Thank you.
Thank you. Thank you so much, sir. So I think innovation is the way to go, and it all boils around going with good fundamental research and sound clinical research going forward. But on that note, taking that journey forward, once the drug is into the market, I put this question to Dr. Sunil Iyer, sir. So what is the importance of phase 4 clinical trials, especially in settings like India? How can we encourage and facilitate the active participation of doctors in such studies? Given one of our earlier panelists said that India is such a diverse population, diverse people suffering. So, it's an opportunity to generate data. What are your thoughts on that?
Sure. First of all, thanks for having us all here. It's been a pleasure going through the sessions through the day. I'm sure most of the people, I heard out the thoughts, and we have a lot of literature and publications to this. This thing. So I think I would summarize it in 3 E's. The 3 E's being the first one, engage. The second one being educate. And the third one is execute. Once I believe the engagement part, by engagement I'm not only referring to just the, the August audience here. It's the, the approach of going into 3-tier towns. How good are the physicians or the care providers or the nursing staff who are involved in generating the data? We've talked about all of the AI and everything, which is very good, but it cannot be, the quality outcomes would seriously depend upon the input of the data which is going into all of these platforms. So that would be the first one. In that, the engagement, in that the physicians and the care providers and the nurses who are going into this data or providing valuable data for data inputs, how engaged are they? There's much more than just money. Yeah. There's much more than, it's more into recognizing the value they are going to add in the whole process. That's the first one. So the second one I mentioned about education. Basically, one could think of multiple methods to do it. It could be, and this is where even the industry can contribute significantly, in that the physicians and the other providers should be regarded as partners for development. It could be in the form of dissemination of appropriate information in the form of flyers. It could be, engaging them into sessions. It could be paper-based evaluations for the staff who are involved in these data collections. Sure. And the third one, which is the execution part. We talk a lot about all these techniques and other things, but ultimately it has to culminate into tangible benefit and translate into tangible benefits, so that each one of us, whether it's an industry, whether it's a service provider, or all of the eminent techniques contribute to the welfare of the society in a meaningful way.
Sure. Thank you. Thank you, Dr. Ashish, for giving us those 3 E's. But I think the third E, the execution, there is really a sense of inertia there. And somehow the Indian clinician researcher feels that the global research is more qualitative. So somehow there is that sense of nervousness, lack of confidence. And that brings me to Dr. Ashish Andani again. As compared to global framework, Indian medical research is somehow doubted. How do we generate that confidence?
That's another very valid question, and I'm sure many of us who are in medical research must have faced this problem, that when we generate the data and when we go to some journal to publish, the journal first starts with a doubt. And the main important reason behind that, in my experience, is that our data practices many times are not as they are in the European standard. I'm sure many of us, you may have seen my post a few days ago where I have raised the question of some bank people calling me day in and day out. Why does it happen? Because my data gets leaked, and that is the indicative of the data practices that we have in India. So this is one side of it where data privacy is challenged. But now coming to more technical from the medical data perspective. Even the big hospitals currently have no electronic databases. Now, fortunately, the government has come up with the electronic databases of their patients and the electronic medical record or electronic health record. So in absence of the traceable records and the audit trail of changes, the data cannot be considered to be 100% true. And that is one primary reason. Second important reason, this data standards. If we go and see the medical billing process of any country other than, say, the developing, some ASEAN countries, I will not say developing, ASEAN and African countries, even the smallest medical terminology in the data, in the patient's information is coded with some kind of dictionary, either with ICD-10, which is the most common, but if not ICD-10, at least with CoStar, at least with SNOMED City, Medra, whatever, the data is coded, and therefore the data transfers is, they are much more easier. The third thing that happens is the data standards. So there are three major data standards which we currently have. We have ISO 27001, we have HL7, and then we have SNOMED City XML. None of these standards even exist in any kind of the hospital which is even implementing the electronic databases, because doctor scribbles something and its copy is taken and uploaded into the medical record. No one even bothers to digitize that electronic record. So electronic record doesn't become a digital record, and therefore the automated transfers of the record, they don't happen. And therefore when the data traceability is not end-to-end, definitely there is a scope of doubt, and this scope of doubt then augments, and then it has its own, like, on the other side, as I said, data privacy are the problem, ethical issues are existing, and then our media many times play a role of creating the negative aura around the things, and all put together, a negative environment around the data infrastructure of India is always created. And that plays the role towards the doubt on medical data in the international society.
So I think the gap is largely around data transparency, where the West is too protocolistic and we have a learning curve some time away, and a lot of learnings in that direction. We now move this segment slightly on the regulatory research side, and my first question would be to Dr. Praveen. Dr. Praveen, regulatory affairs is an important part for drug development and in supporting business to bring the drug in the country. What are the challenges and opportunities in this domain as you see going forward?
Sure, thank you so much for the question. And first of all, let me clarify, I'm not a doctor, and it's pretty difficult to be in a panel session where all of them are doctors. Yeah, but still I will try to justify. So I've been in regulatory affairs all my ages, and I think I've seen the kind of transformation which India has gone through. Although even today, if we speak, India only contribute around less than 4% of participation in the global clinical trial, where we have a population more than 18% of the world population. So I think this clearly depicts where we stand in terms of the India participation on a global arena. Despite we have already some of the tailwinds which really contribute for India to be, nudging in the global clinical trial. We have a high disease prevalence, we have a low-cost country, And India has started also been considering as a China +1, because now I think there is a lot of focus for India, and a lot of the global players want to focus on India. But despite all of that, these numbers are not increasing that significant, which it should be. And there are few challenges which we've been focusing even to the government on different panels that we should be able to address. And one of the foremost which comes to us is kind of unpredictable. We have seen the cases even in 2014 when we saw there were few incidents happen and there was a media trial, and then that really led to India participation as 0 in the global clinical trial. And people generally don't forget those incidents, and still even in 2024, 10 years from now, still people remember the time from 2014. And that shows India we need to improve on the predictability side. But there are, of course, other challenges as well, which can still be handled. But I would say the major challenge is in terms of the unpredictability. Even from a regulatory reforms, there has been many reforms which has happened. Even the new drug clinical trial rule, which came in 2019, I'm not sure how in depth you would be aware, but that really propelled some of those aspects which regulatory affairs or clinical research has addressed, but that's not fully been done. I think there is a lot of scope for it to happen.
Sure.
And the third, probably I would also say, is on the capacity building. More from an investigator side as well. We have tier 1 cities where we have, the Apollos or maybe Medantas or Fortis, those sort of hospitals which have those all capability and have the in-house infrastructure. But we also have to focus on tier 2 and tier 3 cities, because that's where majority of the participants would come. So I think these are few of the challenge which can drive India growth from 4% to, I will say, 15% would be something which we would like to see in coming years to come.
Thank you. Thank you so much, Mr. Praveen, for putting out those insights and giving us a tangible benefit. And I'll quickly move slightly beyond pharma and put out the first question to Dr. Ashok Kumar Thakkar. There's a lot of emphasis in Make in India medical devices. This requires research in India. What do you see are the challenges, and how do you think we can go forward on this?
Yeah, thank you so much, for asking this question. And first of all, I thanks for Medical Dialogues, for motivating such, medical research in India. I really appreciate for this, initiatives. So medical device clinical research, like it's something new, and when, I believe, what are the challenges? Every step has challenges. It's not easy, when we talk about, starting the research, research question will come in our mind. Then, we have to start with the regulatory submission, ethics committee submissions, the selection of the right investigators, after right selection, conduction of the clinical trial, and then, the putting all together to analyze it, and the finally publications. So every step has challenge. It's not very easy, I can say. And when you will not find, the right people, the right teamwork, commitment, then every step has, more challenges. But if you find right team members in right direction, right mentorship, you will find all the tasks should be, easy going, smoothly going, and you can achieve your, the goal. So I believe every step has challenge, but it has its own solution, and it can happen with the right teamwork and right mentorship.
Thank you. Thank you, Dr. Ashok. I'll just quickly come back along same lines back to Mr. Praveen. We are talking that, and in drug trials, there is more clarity. But when we are talking about clinical investigation around devices, we are still at a nascent stage. Would you just quickly like to share your thoughts on this one?
Sure. I think that's probably one of my favorite topics to talk about. So I think very briefly, the trials or investigations for a medical device is very different from the drug, because as we also see, the number of the clinical studies or investigation for a medical device will be few thousand. But if we compare to a drug, which will be maybe more than 100,000 global clinical trials and studies. And there are reasons for that, because the drug have various means of, let's say there are ethnic factors, and that's the reason we need to do study. Even if some drug is approved in US, we want to see how that drug is behaving in a different population, which is not the case for a medical device. But having said so, I think to this fraternity and looking at this audience, I think there are few things I want to specifically highlight for medical device, because this is the question which we keep hearing, because there are a lot of incremental innovation, as one of my panel member was also saying. And there's the role of a clinical researcher would come. We might not need to develop a fully new drug, because that may be a setup like a pharmaceutical company can do. But from an incremental innovation, as a physician, you would have a lot of ideas which can really help to make an incremental innovation and make a device better. And in device, I think these kind of incremental innovation keeps happening. So whenever you have an idea, how a smaller innovation can really have an incremental innovation, and that how an industry can adopt, I think that's something you should really vouch for. You should reach out to your peers, maybe to someone in regulatory affairs, because that's sometimes I got a lot of question that we have something to add it in the existing product, but how would we do it? Because there is a long regulatory pathway, and there is someone as an expert which can really help. And even from a government side, I think even we heard from the last panel, there is a lot of focus, and we know even our PM vision, which was from Jai Jawan, Jai Kisan to Jai Vigyan, and now it's Jain's Anusandhan as well. Because the government also understands how important that innovation is. And I don't think there is a lack of fund. Probably there is lack of how we are approaching it, and that has to be corrected.
Thank you. Thank you so much, Mr. Praveen, for summarizing that the message is incremental innovation. And I'll quickly go back to Dr. Sunil Iyer for incremental innovation thoughts around pharma. You come with a lot of experience in biopharma. How do you see evolving methodologies of BAB studies influencing the approval and market acceptance of generic drugs, which is so relevant in India?
Sure. Having been around for more than 25 years in this field, I think it's my passion and privilege to talk about this. Bioequivalence studies have been around, much more, I think about 35 years or so, but when these guidances and everything were formalized. They have become quite acceptable tools for approvals and marketing in the Western world and also globally. Unfortunately, it's not to that extent in India, whereby the education level of or acceptability of bioequivalence in gaining not only approvals but also in terms of the physician getting acquainted to the drug and his or her confidence in prescribing the medication relies much more on clinical trial data rather than making use of this a very important tool and gaining approval and prescribability.
Sure.
So this is something I've been vouching for in my workplace through the years, and we've had reasonable success whereby on a case-to-case basis, bioequivalence studies would certainly be useful not only for approvals as well as but also to gain some kind of a market acceptability in the physician's heart to prescribe the medication.
Sure. So, thank you. Thank you so much, Dr. Iyer. And I would like to close this session with a final question for Dr. Thennati. So, where do we stand drug discovery in India versus the world today? And where do we envision this in the coming decade? Your thoughts?
Yeah. So, when you talk about the world on drug discovery, many of the big pharmas, they learned last 5 or 6 decades what is drug discovery, what is failure, what is the drug-drug interactions. There was a drug terfenadine which used to cause QT prolongation, but that was approved. But then came the fexofenadine. They know when to screen when you are developing a candidate. Whether there is a hERG potential, there is a drug-drug interaction, there is a CYPs and all those things. And they have a line of things, whether I have a right target, I have the right biological assay, I have a right patient, I have the right screening model, I have the right business. So when they say R, that has a lot of meaning. When you say safety, it's not just safety. Just before testing the compound in animal, they look several things, in vitro, in vivo, and all those things. And we need to learn that. I mean, there is a lot of understanding outside, but we are starting that. And but in terms of learning, it's not so difficult. There are tools, there are systems, there are tests which can tell you quickly. But we need to make it as a practice. I mean, it needs to be kind of a book asking a fundamental thing: why I want to do drug discovery. What is the meaning of target? What is the unmet need of this disease? And unless we don't ask the right questions and try to answer one after other, then it's difficult, but we would be able to succeed in all those things.
Thank you. Thank you so much, Dr. Thinnati. It's about going back to the basics and doing the hard work, and it seems like we are on the right path. Thank you for being a great panel. I'll request Dr. Kohli to take over. Thank you so much.
Thank you, Dr. Jigar, Dr. Prem Agarwal, and the esteemed panel members for such an engaging discussion.
Just a minute, I'll just comment. Well, it was a most interesting session. In fact, with Raj Kumar, Sunil Saab, and Thakkar Saab, and others. They're the leaders who have shown the success. They're the people who have shown that India can shine. But I'm not able to understand that the academia and the industry collaboration in India, difficulted by the regulatory authorities, is one of the biggest hurdle I'm finding. The industry is not understanding the importance of research in the country. They may find multiple reasons that we cannot do it because of this. But as an industry, I've seen they have outlived all challenges. If it comes to any challenge, अभी challenge आया था ethical committee का अचल साहब लेके आए थे, अचल साहब बाहर हो गए, वो issue वहीं रहा. So the challenges can be dealt with industry. If industry is committed that the research should be promoted in the country, it will be promoted. And we have got the industry leaders here who are controlling more than majority share in the pharma or otherwise. Why can't you two together can say that the medical research in the country will be top? And then you can take up all the hurdles. With the regulatory authority, no issues. You can manage the regulators. You can manage the academia. You can manage everybody. So industry is a major force, I believe, in shaping the country's research. So we are very proud to have the leaders of the industry with us, and I'm sure that they will guide us through. And number two, what is this discrimination that pharma, device, and other things? Now you have got the research capabilities. Why can't you take the device? Why can't the device get to pharma? Biosimilars is a new issue, and excellence in innovation is a new issue. So everything which is coming on 200 rupees can be brought in 20 rupees. That is what the vision of our great Prime Minister, Shri Narendra Modi ji. And that vision belongs to us, an ordinary man. He got votes because he was talking something which is my vision too. And now he is being failure because of us. So I believe that this session will stimulate, not me, will stimulate them to act fast and take this country in the next level of medical research. Which if Sun will do it, so 2000 pharma will, everybody will do it. They are rat race. Pharma में rat race होती है सर, जो ये करेंगे वो आप भी करोगे, जो ये करेंगे वो भी करोगे. So let's begin the rat race today with the leaders of rats coming here and pushing on the research. Thank you very much.
Ladies and gentlemen, put your hands together. Now I'll request Dr. Prem Agarwal to do the honors. Please give a memento to Dr. T. Rajamanna Thinnati. Dr. Sunil S. Iyer. Dr. Ashok Thakkar. Dr. Ashish Indani. And Mr. Praveen Jain. We can have a group photograph.
Thank you very much for those wonderful discussions. Ladies and gentlemen, we have the final scientific session, which we are about to begin, session number 5. And after this, we'll have a lunch break. और उसके बाद वो सबसे important segment जिसका इंतज़ार हम कर रहे हैं हमारे Blackbuck Awards. So let us dive into this session very quickly, titled Medical Research and Medical Education. Ladies and gentlemen, we would now be inviting the chairperson of the session, Dr. Achal Gulati, on the stage. Zordar taliyan, Dr. Achal Gulati ke liye, zordar taliyan. May I please request session moderator, he's already here with us, Dr. Kamal Kant Kohli. Please put your hands together for Dr. Kamal Kant Kohli. The co-chair for this session, Dr. Yashpal Sharma. मैं स्वागत करती हूँ, अभिनंदन करती हूँ. Please हमें join करें. जोरदार तालियां Dr. Yashpal Sharma के लिए. Ladies and gentlemen, inviting our panelists, Dr. H.S. Chabra, Dr. Alexander Thomas, Dr. Rajiv Sood, Mr. Harsh Nagpal, and Dr. Shubham Anand. Requesting our panelists to kindly please quickly join us on the dais. Can we have a louder applause, ladies and gentlemen, for each one of our panelists who've joined us here. In the dearth of time, I've been requested to skip certain important things, but quickly request the moderator to take over the proceedings so that we can save on time. मैं निवेदन करना चाहूँगी हमारे moderator से कि please आप जल्दी से session की शुरुआत करें.
Hello. Thank you, Juhi. Since we have paucity of time, I'll straight away go to Professor Achal Gulati and open the discussion by asking him about current status of medical research in medical education nowadays in India.
Thank you, sir. I think two topics, medical education and medical research, two issues. अगर मैं इसको एक हिंदी गाने का रूप दूं, तो एक बहुत पुराना गाना था. अजीब दास्तां है ये, कहाँ शुरू कहाँ ख़त्म, ये मंजिलें हैं कौन सी, न तुम समझ सके न हम. I think this summarizes where does medical education start, where does research start, how does it go, where does it finish. We are still in the process of understanding. और अभी आज तक अगर मैं पूरा बोलूं कि have I understood it? No, I have not understood it. So having said that, when we talk about research, if I look at it, when I was doing my MS, let us say in PGI 1981-82, that time what was taught in recent advances, paper 4 in ENT, today is taught as history of medicine. That's in about 40 years. But time has come today when recent advances in the next 10 years is going to be history, and by the time our kids come in, the recent advances to history would be less than 5 years also. So we need to keep up with the race. If I don't keep up with the race, I'm going to be lost. किसी ने वक्त से पूछा कि तुम हर वक्त भागते रहते हो, क्यों भागते हो? तो वक्त ने कहा, मेरा काम है चलना, मैं तो भागता रहूँगा, अगर तुम मेरे साथ नहीं चलोगे, तो तुम पीछे रह जाओगे और दुनिया तुम्हें भूल जाएगी. So keep that as, I think, to start the basis for the discussion on medical education and research. I think the moderator would take it up further from that. Thank you so much.
Thank you, sir. Let us hope we catch up with time in coming times. Professor Sood, you have been associated with a government medical institution for a couple of decades as faculty and dean. Can you enlighten us about issues and challenges government medical college and hospitals face when it comes to medical research?
Thank you for this important question. When it comes to institutions, medical institutions, right from you see that we call PGI MER, that is medical education and research. But where is the research? There are thousands of institutions. And when we talk about education, now you know that after 2019, lot many reforms have come in education. That is competency-based education and also outcome-based education and also skilling. But there is another aspect. I had been in Medical Council of India. Now I am in the Governing Council of National Medical Commission. The focus has been shifted now. And in all the education, how to inculcate the orientation and the sense of research, it has been now along with the education methodology which is being modified and boost has come after COVID. The research has been integrated now and research, biomedical research and medical educational technologies. And all three, education, medical educational technology and R&D has to go hand in hand. Other factors like skilling and also artificial intelligence integration and orientation is very important. When there is any inspection from an MC side, we see where is your central research unit. But usually any lab is shown in thousand odd institutions or some certain things are there. The second is data. Data, no time to process the data, collect the data, process the data, prepare your guidelines or prepare your SOPs. These all data processing and the proper use of data has to result in publishing. Medical institution has important role in getting it to the culmination of publishing, whether it is meta-analysis, whether it is case series or original research. And research also, when we apply in the medical education, there are three types of research. One is basic research, one is applied research or clinical research. When we talk about the clinical research, where all of us are oriented more. So that include these clinical trials which are coming. I happen to be in drug controller also. There as member, the devices and all which all was discussed. These are all innovations or research and how to implement it in the Indian orientation. So these all components are now integrated in the institution. Only thing is that promotion cannot happen now unless you have done the basic course in the research methodology. So this is important. Publishing is important. Earlier it was cut and paste. Now we are step by step and very fast progressing. Plagiarism, softwares, compulsory making that in publishing. So I have given you the outline that what all we are doing in India on this. Main crunch, however, remains funding. Then funding we can discuss in the now in the panel that funding is the main problem. Around 90,000 to 12% increase in the health research funding has occurred in this year's budget. But that is not sufficient. Still that is not sufficient. We don't have that basic population-based data. That is another thing. And where to get the more funding. That is important. More funding by the institution, private institution, derive of their own, or even CSR activities. We are using to donate wheelchairs or donate ambulances and donate. They can donate in the medical research also. So this is also very important. So various components in the institutional role of the research, medical research, cannot be separated. It is integrated process.
Thank you. Thank you, Professor Sood. Dr. Chabra, you are president of NBI and have been associated with private institutions imparting PG teaching to doctors. what are the major challenges which you face in private sector when it comes to integration of research in medical curriculum in private sector?
Thank you. I would want to start by thanking the organizers for giving me the opportunity and especially to share the platform with my mentor and patron in this field, Dr. Alexander Thomas, who has been into the field for a very long time. When it comes to the private healthcare providers, the barriers which they face are different. And I think the most important barrier is the will and motivation to engage in medical research. And in that, I think one of the most important factors again is the lack of awareness. One, that doctors can be good professionals only if they engage in education and research. It should be an ongoing process. Doctors who engage in research keep updated with the latest in knowledge for treatment and can make better practitioners. So this awareness is lacking. The other awareness that is lacking is that you can have, in fact, it is common knowledge abroad that institutions which are research-based have a much higher EBITDA than institutions which are only engaging in service delivery. This sadly is lacking in India. Is there any institution like Stanford or the likes which are again based on medical education and research which is there in India? I think there is none. We can't talk about anyone. But there are models which we can emulate. And one of the main barrier there is again the awareness that you need to also focus on transdisciplinary and translational research. Unless you translate the research, the usefulness of that comes is not there. You can't tap the potential. And that needs to be done on a war footing. Again, we are aware that most of the research which is conducted in India doesn't get published or doesn't get translated. So this awareness is the job which needs to be taken up on a priority and is one of the biggest barriers which may be there. The other barrier which may be there is a lack of an enabling environment, right? Unless institutions provide an enabling environment for research, the doctors practicing there will not be able to practice research properly. And for example, one of the most important barriers in healthcare institutions which are private is a lack of a biostatistics department. So very important for research to be carried out. And doctors in the curriculum do not have a lot of emphasis on biostatistics. And this is one of the great barriers which are there. Then the clinical, ethical and regulatory framework also is often lacking in private healthcare institutions, though they are, but how many institutions in India, private institutions, have an institutional ethics committee? There are many which are lacking, and this may be a barrier. Resource limitation, of course, may be there, but if there is a will, this can always be overcome. You can find out ways and means with that. Again, the difficulty to find doctors who would be interested along with service delivery in education and research is something which is lacking, right? The major institutions across the country, they face a challenge how to have teaching programs, inculcate research, then what to talk about the other smaller institutions which are there. Then collaboration, right, with other academic institutions is not very easy for healthcare providers in the private. And of course, sustainability of research programs. We can go on and on. There are a lot of barriers we know because India being such a vast country and having problems, healthcare problems which are unique to the country, which are not faced in other Western countries. there is a huge potential to improve healthcare delivery through research programs, and we need to tap this potential.
Thank you, Dr. Chabra. Dr. Alex, you have been associated with a number of non-profit institutions, including AHPI, Anbai, and Kaho. As founder and patron, how non-profit institutions are contributing to medical research, and what are the challenges they face for promotion of research?
I'll probably go beyond your question, since I work both with government, private and mission and non-profit. I will ask all of you a question. Now in postgraduate medical education especially, which do you think is one of the most wasteful things that happen? Well, I was just discussing with Dr. Gulati, and I think all of us would agree that this thesis that most of the postgraduates write, not all postgraduates, both for National Board and for the Medical Council, 70,000 theses almost every year. And I think all of us would agree that this is a colossal waste of time, because as was already mentioned earlier, it's a copy and paste. So I think this is not, this is one area, if we are able to address, I think we'll make a big difference, not only in private, not only in government, but all over the country. And to put in a nutshell, why is this situation? Why are MBBS people, I'm glad to hear that NMC is working actively. I know that the National Board is doing a fantastic job in trying to promote research. But in my opinion, having worked in various, I may be wrong, I think we lack a research culture. We are not taught that we may have started, but not taught that in MBBS. In post-graduation, we are taught that thesis is just something that you really don't take seriously. So I think it's very important that we introduce a research culture. And how do you do it? I must compliment medical dialogues, because this is one of the few functions where I've seen where research is being incentivized. Very rarely are research champions, researchers honored, and I think this is one thing that we need to look at. All the other points have already been mentioned. I think funding constraints, many of the institutions, and I must also say that there's this huge opportunity. It's not only in medical colleges and not only in DNB hospitals that there is scope for research. The smaller hospitals, 100, 200 beds, have huge scope. But as Dr. Harvinder said, they are not aware of what are the pros and cons of research. Unfortunately, in our country, the bottom line is money. And I was just quite pleasantly surprised to hear that the profits or the revenues are much better in a research institute. And I know many institutes which are doing well, both in research and otherwise, and one of that is my alma mater, CMC Vellore. There are other problems that have been mentioned, but I think one of the initiatives should come from the government. I think they should try and make it easier for effective publication. We all know that many of the research projects from India, we don't have too much credibility, the quality is not very good. So I think each institution, and especially the NMC and the National Board, should take steps to start in encouraging research at the MBBS level, ensure that there is a research culture, and for a research culture you need mentors, people who are experts in research who also train their students. So I think it's a long way off, but I think we can get there, because we have, India as a country has really done well in many other areas. We have huge potential. If only 10% of the 70 to 80,000 theses are actually converted into research papers, which are of quality, I think we would make a mark in the globe. Thank you.
Thank you, Dr. Alex. Mr. Harsh Nagpal, you are associated with Walter Fluor's India, and you have huge experience of managing digital tools for medical research and education. Let me ask you, how can digital platforms enhance quality of medical education and research in India?
Thank you for the question. And my question is a bit different. I think it talks about the quality of the education and research part. So I'll try my best to give the best viewpoints, but it's both an honor and privilege to be part of this eminent gathering of medical professionals who are dedicated to education and research. But let me start with the fact. More than 600,000. That's the number of specialized and super specialized doctors that WHO recommends for India in the next few years. Now, it's an important number to remember. But here's the thing, that it's very crucial to leverage innovative digital platforms, especially in the field of education and research. Now, there are various sectors beyond medical that have not only moved on from digital acceptance, they're starting to embrace AI. This is of no exception to medical education and field. As Dr. Rajendra Gupta said in session 3, this is the time to adopt or perish. And at Walters Clover India, we're committed. We're committed to provide that 100% to innovation and to excellence. And I think it's very important when you talk about quality, that important parameters like alignment to the curriculum. It is very important to provide those research insights, deep insights, advanced analytics, and clinical practices. And we got to provide, as Dr. A.K. Agarwal said, we have to start living and breathing innovation from early years. You have to start recognizing that effort. And I think this will embrace quality. The digital platforms, the innovation solutions, if they're not able to understand what a student, faculty, or a researcher wants, they're not going to be adopted. They're not going to help support the medical quality. And hence, these platforms are critical to form a strong foundation. Platforms like New England Journal of Medicine. Now, these are innovative platforms with an impact factor of 175. We talk about impact factor of 3 or 4 as being top-cited journals. 175 and giving access in the early years, that's exactly what the students crave for. That's exactly putting them in the right path. Books, somebody said that books are not going to go away. I completely concur that statement. I'm absolutely support to it. They're not going to go away, but the way of consuming information, the old traditional way, is already retired. That's gone. We're living in a creative, innovative way. And that's how you got to let students, let researchers, let faculty embrace that. It's change management. And with that, the quality will improve. If you're going to empower those users, if you're going to ensure that they have access to the most reliable, most impactful, most insightful medical information, you are supporting the quality in the field of medical education and research.
Let me take it a little further. In the age of artificial intelligence and digital transformation, what are the innovations that can support and enhance medical education and medical research, sir? To address to you, Mr. Nagpal.
It's for me?
Yeah.
Yes, all right. So thank you for asking that question. I think AI is the next step to digital. I want you to visualize. Let's assume medical students are able to grasp the complex concepts instantly. The researchers have access to top reliable data effortlessly, and the faculties are able to create tailored learning methods to meet each student's needs. With AI, this is already happening. It's already happening in pieces, and some of those institutes, some of those hospitals have already picked up. They've started the beaten. Same, at Walters Clover India, we are one of the first publishers to launch the New England Journal of Medicine of AI. We also launched Lippincott Medical Education AI. Again, the goal at the end of the day is to ensure that we let these students, we let these faculties, we let these researchers navigate through tons of data available and may provide them those tailor-made recommendation of impactful information. You're saving time, you're empowering them. You have a book in the early years, in the preclinical years itself. If you're providing books and you're not giving them plain vanilla PDFs, I'm absolutely against that. But if you're giving them books that allows them to validate information of a complex concept instantly, that is where you're ensuring that you are mixing, you're giving a blend of practical knowledge and a real world usage. And if you're giving all this information and they're still taking a lot of time to search through it, they're wasting time. You have to give them advanced search capabilities. You have to provide them indexing on all this information. So if they search, they're able to get all this information instantly. Because that's exactly, you are ensuring that you're creating a capable student, a capable researcher out of the field itself.
Thank you, Mr. Nagpal. We have amongst us Dr. Shubham Anand, a budding researcher. Dr. Anand, which challenges medical students have to face when it comes to conduction of research. And I understand you have started your own journal also. What prompted you to start the journal?
First of all, I would like to thank whole Medical Dialogues team for inviting me here with such eminent group of personalities. So the issues which we face as medical students for any research product, the most important issue is time management. We all know that in India, like even the postgraduate, it's so cumbersome and time consuming. The clinical practice is so time consuming along with managing the curriculum. It's really tough on their part to give proper time to the research. If you see top universities across the globe, if you take the example of Harvard Medical School, if you want to get an MD degree from Harvard, you need to have a minimum 4 full month dedicated research time for your thesis, and along with that you get 1 month for writing your thesis. That's virtually like totally impossible in India, because in India already the PGs are very overburdened with the clinical practice. Second most important point is that lack of experience and of basic research methodologies. What I feel, the basic research methodology workshop should be conducted among the undergraduate level at MBBS level, because when we see that most PGs, when they come for the postgraduate training, they are totally unaware of like what research methodologies are. So if basic orientation is given at the MBBS level, it would help them in the postgraduate level as well. Third issue which I faced is limited resources, like restricted access to funding and equipments and cutting edge technologies is also a very big factor that holds back. Another issue is publication challenge. Most of the research work, students are not able to publish on any journals. It lies like more than I think 70-80% of research work in India lies unpublished. Even the thesis that medical PGs do, it lies rotten in the libraries. No one even dares to even see them. So we need to have some, and also lack of research enthusiasts as like guide or co-guide, that also holds back in producing good quality articles. Because if the co-guide or if the supervisor is not that research enthusiast, it will ultimately affect the quality of the article. So in that, this also leads to rejection of thesis many times. What made me start our old journal, that is Global Journal of Medical Students, because we wanted to promote research among the undergraduate medical students community. We wanted to fill the gap, because undergraduate medical students and postgraduate students are, I think, very underrepresented. So we wanted to provide them a platform that gives them opportunity to publish their articles. And also, we wanted to reduce the publication delays, and we wanted to provide a free platform that helps them to publish their articles.
We wish you all the best of luck. Dr. Yashpal Sharma, all the panelists, Dr. Chabra and Dr. Sood, they have enumerated the barriers and challenges which we come across while promoting research in private sector or government sector. How can we overcome these barriers according to your view?
Basically, I just want to tell that India will soon become number one in medical research. At the present, China is number one. China has surpassed other countries because there are innovations, new ideas, new value-based research, quality-based. Majority of the data which is there in the books will become obsolete because that will become a history. With the new innovation, I tell you a very important story. We started working in PG on cardiogenic shock with comorbidities. The patient which used to be very sick, and when we started treating those and presenting in the international conferences, the question came, how did you dare to take these patients? It was very, at that time. Then they told that if we take such patient in United States, because that is not in our books and journals, they are excluded from all trials. And if we treat, insurance will not pay. So those patients are not taken in even research and otherwise. So there was no research on cardiogenic shock with comorbidities. all patients were excluded. So then we thought that it's very interesting. In India, you can treat the patient in an innovative way. The patient's relatives are so in that way. When the patient is dying, they will tell, doctor, you do something. We are ready even if the death on table occurs. So such sort of patients when started surviving, and we did research, and nowadays 80 to 90% of those patients are being survived. There are patents on those also. So basically, I just want to tell that there should be like IIT institutions and this industry. These should have an academia, this one and government. So if new products, new methods, new things are made, immediately there is hope that we will get a very good product and research for software and hardware. Secondly, at one time, Indian valves, Indian stents, they were just told that all US FDA are others. But nowadays, with the research-based, all studies going on with Indian stents, they are having almost same result with the others. So basically, it's a technology, hardware, software, your values. Just I tell you, because I was here about 7-8 years back with Dr. Prem Agarwal. He called a press conference. He called me that you should come and have a lecture. A simple thing, how this small mistake goes on, innocent mistake. Hemoglobin, which people were saying that it is 10 is normal, 11 is normal in Indian. Why Indian? In Indian 10 is normal. Indians are not as different as compared to when you change their diet, change their value, everything will become same. Normally 15 to 17 in females, 14 to 16 in females, and 15 to 17 in males. If you achieve that, majority of the heart function improves, heart regurgitation becomes less, and the patient do not need any cardiac transplant or valve surgery. Interestingly, one of our dean, Professor Gujral, whose students are Dr. Venugopalan, Dr. Validan, and Dr. Cherian, he came to my office. He was having, in the elderly, when he was around 85, 90, some cardiac problem and all. When we were discussing, I told him, he said, Dr. Yashpal, if you had told me, I would have played golf. I would not have operated valve surgery. Majority of would have been corrected. And the blood transfusion I was giving during or after, I would have given before. So there are some innovations which are beyond imagination, how a small innovation can change. So with this whole data, we have patented this. Whatsoever in the New England Journal, other books, some of that will become history. New data has to be created for all. So just a small in that way. Basically, for publishing, the government as well as this, they should be so fast, and as it in the Western countries, contribution of this is less. They help in writing. They come immediately. You give an idea, book is within 10 days, that goes on in the whole world. This is we should learn there how the books are written there. So the book should start China. We do not know their language, but they do plagiarism also. Our ideas, we do not know what they are doing, because nobody can learn Chinese language. In English and other, you will read, but they have so many developed with the ideas of India. So how we can have our patents, copyrights, this one screening of those, whether it's not original ideas of Indians. So basically all things, the checks and barriers, and promoting every aspect of this, and interacting, and also encouraging and inspiring the ideas of everybody at college level, school level, doctor level, appreciation. Basically, in India and abroad, what is this? If some innovation occurs, other people say, oh, this is not the way. In Western country, they say appreciate. So appreciation should be for everybody. Because I have gone through many this one aspect, seen national, international conferences, other things. Appreciation for every small child if starts in India, that will promote research as well as everything in India.
Thank you, Dr. Sharma. Now I'll request our chairperson to sum up the proceedings.
Thank you, sir. I think it was a lovely discussion, but before I start, I think We just need to get a few things across what everyone has been discussing. Number one was research regarding unpublished. Now, this is, I think, something which we need to introspect as to why the research has been unpublished. Is it because of lack of opportunity? Is it because of maybe idleness? Is it because of lack of interest? Or is it because of maybe I have not done good quality research and it has not been accepted? So I think this needs a lot of introspection, and this is what is going to help us improve the thing. Now, when we talk about thesis, Alex said thesis is important, thesis is not important. I unfortunately or fortunately, when in PGI, we were in the 3 years of pilot project when no thesis was there. So I never wrote a thesis. The biggest disadvantage was in every interview I was asked what was the thesis topic. I had no thesis topic, and therefore the discussion entered over there. But then I didn't do fairly bad across my years. So good quality ethical research is what is important, and that is really very important for the field of medicine. The National Medical Commission on its behalf has created a few things, which is the competency-based medical education system, deleting the earlier rote learning. You know, what's the point of having, tell me the 12 cranial nerves palsies which are occurring in a syndrome. Why the hell does it make a difference? Carson syndrome hai ke nahi hai? What is the applied aspect of it? That is what medical education needs to focus about. Then early clinical exposure, let's forget about anatomy, physiology, biochemistry, partition, preclinical, paraclinical. The National Medical Commission has made it into phase 1, phase 2, phase 3 of medical education, and that is what I think is going to make a lot of difference. And our evaluation pattern from the earlier rote pattern is now onto the competency skill evaluation based, and that is very important. Today we produce 108,760 doctors per year. Add to that another 3,800 which is going to be added this year. Along with that, 70,000 postgraduate students. So that means 70,000 theses come across each year. And to get a topic for thesis and indulge in ethical research, which is integrated and integral both, is very important, and that is what we need to learn over a period of time. Another thing which I want to do is talk about is train the trainer. We talk about train the trainee, train the trainee, train the student, train the resident. My first intention is train the trainer first, because the computers work on a principle of GIGO principle, garbage in, garbage out. Until my trainers are trained properly how to teach medicine, how to learn medicine, and how to do ethical research, I will not be able to bring out quality residents over there. So this is something which is important. Artificial intelligence has been across the panelists, across these sessions, it has held a keynote over there. But remember, at any point of time, artificial intelligence or augmented intelligence, as it has been quoted upon, is never ever going to replace the doctors. That is artificial, it remains artificial. But any doctor who fails to embrace artificial intelligence is definitely going to be replaced in future, because that is something which he has to get across. Data protection, data is very important. Today the world fights over the data, and that is what research is all about. If Prem Agarwal is there, I need to thank Prem Agarwal, I need to thank Medical Dialogues. Prem, तुम्हारे लिए 2 लाइनें. तेरा मुझसे है पहले का नाता कोई, माने तू या माने ना. When I was doing my MBBS in UCMS, he was 1 year senior to me. Then when he was doing his cardiology, I was director of GB Pant. So we ended up in a reversal of roles at all point of time. I thank Medical Dialogues and Prem Agarwal and Naresh ji for creating what they have done, opportunity and Medical Dialogues. Thank you so much.
Thank you. I request Juhi to take over.
Thank you very much. That was a very, very insightful panel that we just heard. Ladies and gentlemen, we would now like to present tokens of respect and appreciation for each of our panelists. शुरुआत करते हैं हमारे chairperson से निवेदन करते हैं सभी panelists को आप tokens of acknowledgement, mementos present करें, and thereafter मैं मेघना से request करूँगी कि हमारे chair and co-chair को वो present करें. तो आइए शुरुआत करते हैं. Ladies and gentlemen, we would like to thank each of our panelists for their sharings, for the perspectives that they put forward in front of all of us. आइए सभी के साथ शुरुआत करते हुए requesting our chairperson Dr. Achal Gulati, जिन्होंने सार गर्भित बातें, कम शब्दों में ज़्यादा बातें जो कहने का सबसे सुंदर अंदाज बयां किया है, उसके लिए बहुत बहुत आभार. Ladies and gentlemen, let's join hands for thanking each of the panelists, for each of the presenters for sharing their thoughts with all of us today. सभी का बहुत बहुत आभार. डॉक्टर छाबड़ा, डॉक्टर अलेक्जेंडर थॉमस, डॉक्टर राजीव सूद, मिस्टर हर्ष नागपाल, डॉक्टर शुभम आनंद. जोरदार तालियां सभी के लिए. Thank you, Professor Sood, for sharing your insights with us today. Ladies and gentlemen, let's once again thank each of our panelists for sharing their views, ideas, and thoughts with all of us today. Thank you, Dr. Thomas, for joining us here on this panel. And after this, Dr. H.S. Chabra. Thank you very much, sir, for joining us here. May I please request Meghna to please join us for presenting tokens of respect for our chair and co-chair for this session. Thank you, Dr. Gulati, for being here on this panel with us. बहुत आभार आपका और एक बहुत ही खास और अद्भुत अंदाज में अपनी बात पहुंचाने का ये तरीका भी आज हमने देखा. Thank you very much. Thank you, Dr. Yash Paul. The co-chair, Dr. Yash Paul, आपका भी बहुत आभार. Ladies and gentlemen, this was a wonderful discussion that we just heard and enjoyed in the presence of some illustrious personalities from the industry. इसके बाद हम जल्दी ही, after the group picture, we'll all disperse for a quick lunch and we'll come back for the most awaited segment, which is going to be the Blackbuck Award segment. Please join your hands for Dr. Yash Paul. Thank you very much, ladies and gentlemen. With this, we will be dispersing for lunch. We have about 30 minutes because we are hard pressed for time, so we have to compress our lunch break. We request you to reconvene at 2 p.m. for the award segment. Ladies and gentlemen, let us disperse for a quick lunch. Thank you.
You want to?
We're joined by our esteemed guests for whom we all had been waiting. Requesting everyone to kindly be seated, please. सभी से निवेदन है कि अपने अपने स्थान पर बैठें. हम इस बहुत ही awaited segment को अब शुरू करने जा रहे हैं, which is the award segment. Ladies and gentlemen, please take your seats and requesting all of you to please put your mobiles on the silent. Ladies and gentlemen, we are beginning. May I please request your kind attention? सभी से निवेदन है कि please बैठ जाएं. A very good afternoon, ladies and gentlemen. After the enlightening and impressive sessions, morning scientific sessions that all of us came across, we surely have some important takeaways today before we leave from here. We are now beginning with the most awaited segment, which is the Blackbuck Awards for Medical Research. Ladies and gentlemen, it is very interesting to note that today we will have 46 awardees across 41 institutions from 27 cities and 16 states of our country. तो आइए शुरुआत करते हैं. It is time to begin. It is my honor to be inviting our very, very special guests who have joined us here and consented to be a part of this wonderful award segment. सर्वप्रथम शुरुआत करते हुए हमारे मुख्य अतिथि डॉक्टर राजभूषण चौधरी जी से निवेदन है कि आप मंच पर आए. मिनिस्टर ऑफ स्टेट इन द मिनिस्ट्री ऑफ जल शक्ति, रिक्वेस्टिंग डॉक्टर प्रेम अग्रवाल एंड श्री प्रीतेश सेठ टू प्लीज एस्कॉर्ट Dr. Rajbhushan Chaudhary, Minister of State in the Ministry of Jal Shakti, to the dais. Ladies and gentlemen, can we have a louder applause, please? Also inviting our guests of honor, Dr. B. Srinivas, Secretary of the National Medical Commission, to please join us. Dr. Abhijat Sheth, President of the National Board of Examinations, requesting Ms. Meghna Singhania to please escort them to the dais. Ladies and gentlemen, a big round of applause for our wonderful, esteemed dignitaries who have joined us here. सभी का बहुत बहुत स्वागत, बहुत बहुत अभिनंदन. Ladies and gentlemen, we're absolutely delighted at the presence of Dr. Raj Bhushan Chaudhary amongst us. May I please request Shri Pritesh Seth to present Dr. Raj Bhushan a beautiful bouquet to thank him for being here today. आपका बहुत बहुत आभार, बहुत बहुत धन्यवाद कि आप हमारे विनम्र निवेदन पर आज यहाँ पर पहुँचे हैं. जोरदार तालियां हमारे मुख्य अतिथि के लिए. May I please request Ms. Meghna Singhania, Editor-in-Chief of Medical Dialogues, to present a bouquet of flowers to Dr. B. Srinivas, Secretary of the National Medical Commission. And also welcoming Dr. Abhijat Seth, Director of Operations and Finance at Scientific Scholar. Ladies and gentlemen, as we kickstart the proceedings for the award ceremony, before we do so, may I please request Dr. Prem Agarwal to kindly please welcome the august gathering and also set the tone for this segment, please.
Thank you and welcome to all on this occasion of recognizing few of us with the Blackbuck Research Awards. We had a wonderful session since morning on the various aspects of challenges and opportunities, as well as the way forward for pushing the medical research in our country. Medical research is one of the most important aspects of healthcare. In fact, today, our country is reeling in the impact of low finances available for the existing healthcare infrastructure, management of people, because of the lack of or limited medical research. While we can boast of an enormous researcher activities in the ancient world, decimal was found by us. We can boast of Shushruta, we can boast of whatever ancient word had in the form of medical research was from India. But when the modern research came, we were enslaved. That's a time the country was not allowed to do any research activities. And by the time we got independence, we found that we have already taken aback that we are not existing in medical research world. And with the independence, the country was endowed upon the bigger responsibility of healthcare, looking after the health of the people, so many people with no infrastructure. And we were doing and following in line. We're spending all the money we have got in creating health infrastructures. And somehow medical research went down. And the impact of this particular situational happening was that today we are importing all the medical equipment from abroad, the high-end medical equipments, imaging equipments. We are getting maximum drugs, life-saving drugs from abroad at a price which is unacceptable and not required because of pure lack of indigenous medical research. Since we are not producing anything, even if you are producing something, is in the name of some multinational, the profits are going there only. Our Prime Minister's vision, Make in India, Made in India, it falls apart because of the lack of our initiative and participation in medical research. कल परसों बजट में ही 80,000 करोड़ रुपए 90,000 करोड़ रुपए दिए, लेकिन वो मीगर हैं, इतना है to meet to the requirement of 145 crore people at a cost of the equipment and medicine given by the foreigners. So what do we have to do? We have to create an environment that we do everything, whatever we are investing, paying 100 rupees, we produce that at 10 rupees. Not that we don't have research capabilities, production capabilities. The country has shown excellence into the space. We could use Chandrayaan, we could use Mangalyaan. Our research capabilities in producing the supercomputers, our research capabilities in producing COVID vaccine has been enormous. But creating a thing which we are importing from, maybe from China, maybe from America or Korea, but we are not concentrated that health research has to do, and that's the only thing which can give you the affordable health care. Otherwise, any amount of money will not be useful. So thinking about that, we at Medical Dialogue, we are now 7-8 years old, started as a small effort by Meghna, why you are there? Come here. By my daughter Meghna. But then since then, it has grown into a size that today we have got 7 lakh subscribers, registered subscribers, more than 30 lakhs clicks a month, and we can create an impact. Any news goes out of Medical Dialogue is seen by more than 1 lakh people who are with us on WhatsApp in a minute. Any information we send is being clapped upon or being endured upon, and we have become a sort of a encyclopedia for health information. Because Kashmir to Kanyakumari, if anything is happening, it is impacting the life of a doctor. Whether it is information happening, research, program, government, NMC, national board, we try to cover it and send it to people. So this is how we have better. And the impartiality of the Medical Dialogue, the genuinity of Medical Dialogue, is what makes it credible. And doing that, what we realized is that medical research is a very important topic. It's a very important issue for which we have to start discussing, creating a forum and creating a lobbying. Because if medical research is done today with 4,000 crores only given by the medical budget on medical research, and most of that will be taken by the ICMR and some other government organizations, thinking that the research is the domain of medical government only, it is not correct. It has to be done in every corner. Places like Gangaram, places like Apollo, places like Max Fortis or even Sanjeevan. If we just consider ourselves and we create a small part of our funding towards the data collection, data normalization, data presentation, and creating paper, the medical research will go anywhere. So that vision is required, that vision is there. With that, we created this Blackbuck Medical Award. You are aware Blackbuck is a elite, distinguished, rare animal which needs protected. And we are all committed to protect Blackbuck as well as our Blackbuck awardees. They are the researchers. They are elite class of the medical profession which are doing research. And with that, we First we thought that we were putting award, then somebody tell me that the award function to aajkal business ho gaya hai. Maybe you are doing awards but creating business. So we make it an extremely jury-oriented awards. So application was called for, hundreds of applications came, and then the very experienced jury, I will just after that I will name them, went through a rigorous process of assessing. ICMR was involved in, of course, our Dr. Ashok Bagga, Dharmesh Lal, and many of the people. They scrutinized the applications, gave them marks, and accordingly that a list was made. And to my credit of that we collected only 46 awards. And 41 of them, 46 awards were from 41 institutions. For 20 state cities and 16 states, they were not given like this. People have come across the country. And our whole country is represented in these awards. But these awards are not the final one that they are the only the people who are doing it. I am sure that better people, more people are there who are doing better job also. But still, they are the one who are showing up their courage to show their activities. And we are proud of it that they are doing it. So I am very proud that these awards are going to be distributed today. And with the hand of no other than Dr. Rajbhushan Chaudhary, our Secretary NMC, who is responsible for our activities, our National Board Chairman, Dr. Vijay Sheth. And they are the people who are likely to promote us, give us strength so we can promote research in this country more. I'd like to mention, before I start anything, I'll start to mention Dr. Arun Kumar Agarwal, our chairman of the jury board. He's our dean, Maulana Medical College. Dr. Yashpal Sharma, he is a PGI, HOD PGI. Dr. Ashok Kumar Bagga, he was a Deputy Director General at ICMR. Dr. Manish Singhal, he is a consultant and HOD of All India Institute. Dr. Achal Gulati, our dear Principal and Director Professor in TNT, and Dharmesh Lal, Senior Scientist, ICMR. So friends, I welcome you all on this function today. I'm sure that this will give us a strength and courage to continue our efforts to promote medical research in the country. Thank you very much. And I ask you to kindly continue.
Thank you very much, sir, for addressing us and for letting us know the process which has been followed rigorously. Thank you for sharing those wonderful thoughts with all of us and for setting the tone for this award segment. Ladies and gentlemen, we were listening to Chairman Medical Dialogues, Dr. Prem Agarwal, and now, as we know that National Medical Commission, which is an apex statutory body that regulates medical education, medical professionals, institutes, and research. Today, we are honored to have amongst us Dr. B. Srinivas, who is the Secretary of NMC. May I please request him for presenting his words of wisdom. Ladies and gentlemen, please join hands in welcoming Dr. B. Srinivas.
Good afternoon, all the delegates. First of all, I would like to thank Medical Dialogues team for inviting me, for launching such a prestigious Blackbuck Awards in medical research. I really am grateful to them for calling me here. At the same time, I would like to welcome and convey my dearest congratulations to our Rajbhushan ji, our Honorable Minister, who is also from our medical fraternity, our Abhijaj, who is the Executive Director of National Board of Examinations, who is also responsible for another regulatory degrees, which are the DNB and National Board of Examinations. Then I would like to, of course, thank Prem Agarwal ji and his daughter Meghna ji. I know Meghna, she used to come for various interviews, for any news related to NMC. And Medical Dialogues has a very rich cultural heritage in terms of the kind of quality of the medical news that is being conveyed to all the medical students and the medical fraternity at large. So with this, I would like to thank once more all of you for coming here. And as far as NMC is concerned, National Medical Commission is the apex regulatory body which was formed in 2019 after MCA was dissolved. And there were reasons why NMC was formed, and the main agenda for the NMC is to promote medical education and research. Of course, most of our times are now going in mostly for the assessments of the medical institutes, but that is one part of the medical education. Medical education is much more important in the just assessments. We have to ensure that the number of the quality of the students that come out are also at the top class level. As you know, since last 2014 onwards, the number of medical seats have increased. MBBS, they were used around 50,000 seats. Now it's almost 110,000 seats. Another 3,000 seats are mostly likely to add up for this counseling this year. With the same time, we are also planning to have how should we improve the medical education. And the medical education can only be improved if the thinking skills of the students are promoted. And that is possible only through research. And conferences like these where great people are there who are thinking abilities are there, they should promote more research, and they should kind of inspire our coming generation to promote more research and have, so that like what happened in COVID times, we depend on ourselves to promote the vaccines, and today the whole world was looking towards us in making the vaccine, and we became a kind of a torch bearer for the whole world for the vaccine when we promoted the vaccine and gave it to our friendly countries as well. So this is possible only when the coming generations are more inclined towards this research, and conferences like these are very much important to promote this. So with this, again, thank the Medical Dialogues team for coming forward and taking this initiative, and hopefully this will promote in future our future generations to bring about good research into the field of medicine. Thank you so much. Thank you.
Thank you very much, sir, for joining us here today, for sharing those inspiring words, and also for giving us your wishes. Thank you very much. Ladies and gentlemen, now we'll be inviting Dr. Abhijat Seth, President of National Board of Examinations, for his address. NBE, as we know, is an autonomous body under the Ministry of Health and Family Welfare in India, which conducts postgraduate medical examinations to ensure high standards of medical education. Sir.
Namaste and very good afternoon. Honorable Minister of State for Jal Shakti and Law, Dr. Chaudhary ji, Dr. Srinivasan, Dr. Prem Agrawal, Rajbhushan ji, and Meghna, and all my senior colleagues of the dais, and ladies and gentlemen. On behalf of the National Board of Examination, I extend my gratitude to Dr. Prem Agrawal for inviting us. Yes, we are one of the apex body, mainly looking after the entrance examinations at the moment, the national entrance examinations, as well as postgraduate education. We are having a 1/3 contribution to the overall postgraduate education with the DNB courses, and our seats at the moment are around 15,000 in number. So it's very important for us. Since we are running the examination as well as accreditation, our third biggest arm is to promote the education and research. I must accept that these two clinical skills these days are very, very important for apex organization to, like us, NBMS, to directly involve into it. The one clinical skill is a clinical research, and other clinical skill which is communication. And these both are very, very vital, because if the apex organization get involved with this skill, certainly it can make a huge difference, and it will percolate down the line with all the stakeholders, while stakeholders will continue to excel themselves in the rest of the arm of the medical education. Hence, we are there to promote and support clinical research in the medicine. And in National Board, we keep the principle of 3 I's. The one is innovation, one is integration. Integration is we need to integrate to all the national regulatory bodies to make sure that our education resources are maximally utilized for the purpose of medical education. And third is implementation, where we are very strict and we try to implement the discipline of education as best as we can. And certainly I must say that we have still the long way to go. Behavior doesn't change overnight. But if we will start today and we will build a culture like lot of INIs, Indian national important organizations, they have built a culture of clinical research and academics so well. So why we can't bring that uniformity across the country, which is possible? We have started, and certainly within next decade, all this effort, which is not only made by ourselves, regulatory organization, but like Medical Dialogue and all other institutions, which will certainly eventually bring these 2 clinical disciplines, additional disciplines or skills, which will be beneficial to our stakeholders. With these words, my best wishes to all of you. Thank you very much.
As you said, sir, we have a long way to go, but innovation, integration, implementation can surely do some great help. Thank you for joining us today and for addressing us. Ladies and gentlemen, now we'll have the privilege of listening to our chief guest. As we know, he's the Honorable Union Minister of State for Jal Shakti and a Member of Parliament from Muzaffarpur constituency. He completed his MBBS from Patliputra Medical College, Dhanbad, and MD in Medicine from Darbhanga Medical College. Committed to serving humanity, he leverages his extensive medical expertise in his political and ministerial duties, contributing significantly to his role as a senior minister in Prime Minister's government. Ladies and gentlemen, please put your hands together for Dr. Raj Bhushan Chaudhary. बहुत-बहुत अभिनंदन, बहुत-बहुत स्वागत.
Namaste. Good afternoon, everybody present here at the award ceremony organized by Medical Research Summit and Blackbuck Awards. First of all, I congratulate medical delegates for organizing today's Medical Research Award function and encouraging and promoting medical researches. The uncontrolled population and underdevelopment in the medical science is creating a material changes in front of the society to meet with the increasing demand of healthcare. The demand is on the applied research for developing new drugs, investigations, imaging techniques, surgical modalities, and to be able to give a longer lifespan with healthy aging and better disease control. I am aware as a doctor as well as a politician and now the minister in government of India that most of these innovations are industry driven and is done by foreign multinationals, which makes the new invention extremely costly, unaffordable, and creates a depletion of health finances for few instead of all. India has a rich history for medical research. We are the pioneer of Siddha, Unani, Ayurveda, but modern medical research actually started in the British occupancy of our country. Before 1947, for more than 200 years, the great tradition of medical research was put to hold, though the institutions like Indian Medical Council and research were established, yet the contribution of our country towards medical research was extremely low. After independence, the country has been struggling with the financial deficits and has been finding itself difficult to match the need for healthcare financing for the larger population, and medical research took a backstage. It is only after dynamic leadership provided by our Honorable Prime Minister Sri Narendra Modi ji that a concentrated effort has been initiated for Make in India for the healthcare products. An initiative like Skill India aims to train healthcare professionals. In our recent yearly budget, around 4,000 crore has been allocated for healthcare research to create more fellowship programs, research grants, and strengthening the institutions like ICMR and encouraging the public-private partnership to have a bigger role in improving research facilities, collaboration, and partnership. I am sure that our country has enormous potential for research and innovations. Our country has excelled in space technology. The success of Chandrayaan-3 mission achieved a very cost-effective lunar landing. Also, a success of Mangalyaan mission, which is the world's cheapest space mission, is the proof of our strength, capacity for research, and making the things cost-effective. The proof of our strength of research lies in the development of COVID vaccine. The cheaper cardiac stent and valve creating the top and generic medicine, but still the participation of industry and academician is necessary required so that we can boost becoming self-sufficient and self-maintained sector for healthcare. For the same, I once again congratulate Medical Dialogue and Dr. Prem Agrawal sir and his team committed to cause the promotion of this research summit and providing award to the prominent medical researchers in the country. Today's deliberation in the research summit on the important topic like challenges, opportunities, obstacles, and innovations, role of industry and medical education are for discussion, and I am sure you will send me the gist of the deliberation so that I can put it across the cabinet wherever is possible. I also congratulate the Blackbuck awardees for medical research. Rightly mentioned, you are the elite and real part of our society for dedicating yourself, your energy, your commitment in creating new innovation in medical science. I am sure that this event shall bring an encouragement and stimulation for others to follow your path, and soon you will achieve the vision and commitment of our government to be self-reliant and example for others for medical research. And lastly, I am also thankful Dr. Srinivas sir and जो कि NMC के सेक्रेटरी हैं, डॉक्टर अभिजात सेठ जो कि नेशनल बोर्ड ऑफ एग्जामिनेशन के प्रेसिडेंट हैं, डॉक्टर परितेश सेठ जो स्कॉलर हैं, साइंटिफिक स्कॉलर हैं, डॉक्टर मेघना मैम, और इस कार्यक्रम में उपस्थित हमारे सीनियर्स एंड जूनियर्स, आप लोगों को बहुत बहुत धन्यवाद.
Thank you very much, sir, for joining us here today and for gracing this wonderful occasion with your presence. Ladies and gentlemen, after those inspiring and enlightening thoughts, it's now time to present the much-awaited Blackbuck Awards. मैं निवेदन करना चाहूँगी हमारे मुख्य अतिथि महोदय से और मंचासीन सभी गणमान्य अतिथियों से कि मंच के अग्रभाग में आकर आप कृपया शुरुआत करने की कृपा करें. Ladies and gentlemen, we are inviting our guests to kindly please present these awards so that we can begin with the different categories and invite the deserving awardees who are not only doing wonderful for themselves but motivating the others as well. Ladies and gentlemen, these are the presentation of the Blackbuck Awards. Our first category is the Pioneer Researcher Award. This award celebrates the seasoned veterans of medical research who are over the age of 45. Ladies and gentlemen, शुरुआत करते हुए पहला नाम जो पाइनियर अवार्ड्स में है वो है डॉक्टर अभय इंद्रायन. जोरदार तालियां इनके लिए. डॉक्टर अभय इंद्रायन, बायोस्टैटिक्स कंसल्टेंट एट मैक्स हेल्थकेयर एंड प्रेसिडेंट ऑफ द बायोस्टैटिक्स कंसोर्शियम, India's top biostatistician. He's over 290 publications including groundbreaking research in medical biostatistics. He has authored 6 books, ladies and gentlemen. जोरदार तालियां इनके लिए. डॉक्टर अभय इंद्रायन. जोरदार तालियां सभी की ओर से. Many congratulations to Dr. Abhay Indrayan. Moving on, ladies and gentlemen, congratulating each of the awardees. The next name is of Dr. Anshuman Darbari. Zordar taliyan Dr. Anshuman Darbari ke liye. Additional Professor and Head of Cardiothoracic Vascular Surgery at AIIMS Rishikesh. He's authored 90 high-quality research publications, holds 2 copyrights and 1 patent. He's an esteemed editorial board member of 4 international journals and has been recognized with awards such as Ken Dastoor Memorial Award and Mahatma Award. Many congratulations, Dr. Anshuman Darbari. Ladies and gentlemen, अगला नाम है Dr. आशीष इंदानी का. जोरदार तालियां डॉक्टर आशीष इंदानी के लिए. He is the author of the book Essentials of Medical Device Clinical Research, and he has over 24 years of experience in medical device clinical research to develop innovative solutions using AI and modern technologies. He holds patents for systems enabling personalized medicine through sensor-based diagnostics and continuous monitoring. Please put your hands together for Dr. Ashish Indani. Many congratulations. Now inviting Dr. Dinesh Verma. Ladies and gentlemen, zordar taliyan Dr. Dinesh Verma ke liye. Distinguished British Indian ophthalmologist with over 4 decades of global experience. He has held prominent roles including consultant ophthalmologist in England and Chief of Retina Services at Hull and East Yorkshire NHS Trust. Dr. Verma has published extensively focusing on cutting-edge technologies such as virtual reality simulation, retinal chip implants, etc. बहुत-बहुत शुभकामनाएं. Inviting Dr. H.S. Nataraj Sethi. जोरदार तालियां Dr. Nataraj Sethi के लिए. He's an associate professor of cardiology at Sri Jayadev Institute of Cardiovascular Sciences and Research, Bangalore. He has performed over 10,000 coronary angioplasties and more than 3,000 non-coronary procedures. He's a fellow of multiple prestigious institutions including American College of Cardiology and the European Society of Cardiology. Zordar taliyan Dr. H.S. Nataraj Sethi ke liye. Many congratulations to you, many congratulations. Ladies and gentlemen, now inviting Dr. Lokeshwar Rao on the dais. Zordar taliyan Dr. Lokeshwar Rao ke liye. Senior Consultant, Cardiothoracic Surgeon and Director of Research at Star Hospital, Hyderabad and Chairman of the Sajja Heart Foundation. He completed advanced cardiovascular training at the Texas Heart Institute under Professor Denton Cooley. He's authored over 115 articles in peer-reviewed journals and leads pioneering research like the Promote Patency Study and the Predict Study. Congratulations, Dr. Lokeshwar Rao. Ladies and gentlemen, inviting Dr. Prashant Panduranga on the stage. Zordar taaliyan Dr. Prashant ke liye. He's a consultant interventional cardiologist at the National Heart Center Royal Hospital, Muscat, Oman. He's trained in India and Australia. He has authored over 150 publications and has been involved in significant registry studies like Gulf Race, Oman Race, Gulf Care, contributing to improve cardiac care in the GCC region. Congratulations. Inviting Professor Raju Vesh on the dais. Congratulations, Dr. Raju Vesh. बहुत-बहुत शुभकामनाएं. Leading orthopedic researcher from India and is working as a senior consultant orthopedic surgeon at Indraprastha Apollo Hospitals, New Delhi. Apart from being a highly successful orthopedic surgeon, he is a prolific researcher and has 800 publications to his credit with a high index of 55 and 15,000 citations. Wonderful. Professor Raju ko बहुत-बहुत शुभकामनाएं. Ladies and gentlemen, now congratulating Dr. Ramila Hiralal. Zordar taaliyan Dr. Ramila ke liye. Ladies and gentlemen, please put your hands together for Dr. Ramila. She's a professor in the Department of Anesthesia at BJ Medical College, Ahmedabad, with over 35 years of affiliation and 26 years of experience. Dr. Ramila has authored over 20 original articles, 1 review article in 2 case reports with 15 publications in high-impact international journals. Congratulations, Dr. Ramila. Ladies and gentlemen, inviting Dr. S.V. Madhu. Zordar taaliyan Dr. S.V. Madhu ke liye. Director, Professor of the Department of Endocrinology and Center for Diabetes and Metabolism at UCMS GTB Hospitals in Delhi. He is the Editor-in-Chief of Indian Journal of Endocrinology and Metabolism. He's previously served as the Editor-in-Chief of International Journal of Diabetes in developing countries with over 300 national and international research publications and 22 funded research projects. Many, many congratulations, Dr. S.V. Madhu. Ladies and gentlemen, sabhi ke liye ek baar zordar taaliyan honi chahiye. Now inviting Dr. Sudhir Singh on the dais. Congratulations, Dr. Sudhir Singh. बहुत-बहुत शुभकामनाएं. Renowned plastic surgeon at Getwell Hospital in Varanasi, specializes in innovative research in bacteriophages, nerve regeneration, and reconstructive surgery. Ladies and gentlemen, he's authored 6 books and published 154 abstracts in index journals. Zordar taaliyan Dr. Sudhir Singh ke liye. Many congratulations. Inviting Dr. Sukesh Mukherjee. Zordar taaliyan Dr. Sukesh Mukherjee ke liye. Many, many congratulations. He's an additional professor in the Department of Biochemistry at AIIMS, Bhopal. With 17 years of teaching and research experience, he has published over 104 papers in peer-reviewed journals and presented at numerous national and international conferences. Dr. Mukherjee's accolades include the Best Paper Award from Association of Clinical Biochemists of India and international travel fellowships to attend prestigious conferences. बहुत-बहुत शुभकामनाएं. Inviting Dr. Sumita Shankar. जोरदार तालियां Dr. Sumita Shankar के लिए. Professor and Head of Department of Plastic Surgery at Guntur Government Hospital. She has served as Director of Research and Development at the YSR USH. Currently, she is the Chairman and Managing Director of Amaze MedSpa in Andhra Pradesh, India. Dr. Shankar's research includes cadaver studies. Ladies and gentlemen, many congratulations. Dr. Sumita को बहुत-बहुत शुभकामनाएं. और इसी कैटेगरी में जो हमारा फाइनल नाम है वो है डॉक्टर सुरेश बाबू का. जोरदार तालियां डॉक्टर सुरेश बाबू के लिए. Dr. Suresh Babu is a professor in the Department of Biochemistry at Symbiosis Medical College for Women and Symbiosis University Hospital and Research Center, Pune. With over 15 years of experience, he significantly contributed to diagnostic biochemistry, cancer, biology, immune chemistry, etc. He's a boasting citation index of 600. Many congratulations, Dr. Suresh Babu. Pioneer category के बाद आगे चलते हैं और ये है Rising Research category. Ladies and gentlemen, this category highlights the upcoming generation of medical researchers. Aimed at individuals under the age of 45, the Rising Researcher Award seeks to recognize and encourage the groundbreaking work done by early career scientists and clinicians. आइए शुरुआत करते हैं. सबसे पहला नाम है डॉक्टर अभिषेक वैश्य का. जोरदार तालियां डॉक्टर अभिषेक वैश्य के लिए. Consultant at Department of Orthopedics and Joint Replacement Surgery at Indraprastha Apollo Hospitals. He specializes in joint preservation, cartilage transplantation, arthroscopy, arthroplasty, and complex trauma. He has authored 244 publications in national and international journals. Many congratulations, Dr. Abhishek. अगला नाम है डॉक्टर अमनदीप सिंह का. Many congratulations to Dr. Amandeep Singh. Professor in the Department of Radiology at SGRD University of Health Sciences, Amritsar, and serves as President of the Punjab Indian Radiological and Imaging Association. He's over 15 years of postgraduate teaching experience and has contributed nearly 50 publications to index journals. Zordar taaliyan Dr. Amandeep Singh के लिए. बहुत-बहुत बधाई, शुभकामनाएं. Inviting the next awardee, Dr. Arjun Ballal. Zordar taaliyan Dr. Arjun Ballal ke liye. A renowned orthopedic surgeon and founder of Ballal's Healthcare in Udupi. He specializes in complex trauma, arthroscopy, and sports medicine. He has authored over 30 papers, published in leading national and international journals, and serves as an associate editor for BMC Surgery, Medicine, and Indian Journal of Orthopedics. Many congratulations, Dr. Arjun Ballal. Ladies and gentlemen, inviting Dr. Ayush Garg. Dr. Ayush Garg ke liye zordar taaliyan. Associate Professor in Department of Radiation Oncology at SRMS Hospital, Bareilly. With a decade of experience in oncology, he has over 20 publications and has co-authored a chapter on radiotherapy in gynecological cancers. Dr. Garg completed his MD in radiotherapy and served as a clinical fellow at the Royal Marsden Hospital. बहुत-बहुत बधाई. Inviting Professor Bhavuk Garg on the dais. बहुत-बहुत शुभकामनाएं Dr. Bhavuk Garg. Professor of Orthopedics at AIIMS New Delhi, specializes in spine and upper limb surgeries. With 101 research projects published and 57 additional publications in index journals, his work focuses on spinal deformities and minimally invasive spine surgeries. He's authored 50 book chapters and holds 5 patents. Zordar taaliyan inke liye bhi. Ladies and gentlemen, congratulating Dr. Caroline Elizabeth George. Congratulations to Dr. Caroline Elizabeth. She's the head of Community Health, Palliative Care and Research Division at Bangalore Baptist Hospital, a hospital governed by CMC Vellore. She's led the design and analysis of 300 research studies, collaborating with institutions like WHO, Harvard, and University of Texas. She has 40 publications and is recognized for her work in infectious disease care, diagnostics, antimicrobial resistance, etc. Many congratulations. Ladies and gentlemen, inviting Dr. Guneet Aval to please join us. Zordar taaliyan Dr. Guneet ke liye. Associate Professor in the Department of Dermatology at SGRD Institute of Medical Sciences and Research, Amritsar, and Director and Senior Consultant Dermatologist at Dr. Guneet Skin, Cosmetology, and Laser Clinic. Ladies and gentlemen, Zordar taaliyan Dr. Guneet ke liye. She's undertaken numerous research projects and published 25 in index journals. बहुत-बहुत बधाई. Inviting Dr. Pradosh Kumar Sarangi. जोरदार तालियां Dr. Sarangi के लिए. Assistant Professor and Faculty in Charge in Department of Radio Diagnostics at AIIMS Deoghar. He completed his MBBS with honors at JIPMER, Pondicherry, and MD in Radio Diagnostics at Sri Ram Chandra Bhanj Medical College, Cuttack. He's a postdoctoral fellowship in cardiovascular thoracic imaging from CMC Vellore. Ladies and gentlemen, he has 40 publications, including 14 in-text papers. Inviting Dr. Praharsha Mulpur to please join us. Zordar taaliyan Dr. Mulpur ke liye. consultant orthopedic and joint replacement surgeon at Sunshine Bone and Joint Institute, KMIS Hospital, Hyderabad. He has over 30 publications in peer-reviewed journals and 5 book chapters on hip and knee arthroplasty. He specializes in robotic knee and hip replacement surgeries and leads clinical research at Sunshine Bone and Joint Institute. बहुत-बहुत बधाई. Inviting Dr. Priyankar Singh, ladies and gentlemen, Dr. Priyankar Singh के लिए जोरदार तालियां. Associate Professor and Unit in Charge of Craniomaxillofacial Surgery at Indira Gandhi Institute of Medical Sciences, Patna. He completed his super specialization in craniomaxillofacial surgery in Germany and a fellow of the Royal College of Surgeons, Glasgow. He's authored 56 PubMed Index publications and a book on bone grafts and several chapters on cleft lip and palate surgical techniques. Congratulations, Dr. Priyankar. Ladies and gentlemen, now inviting Dr. Raghav Gupta. Dr. Raghav Gupta, many congratulations, Assistant Professor in the Department of Onco Anesthesia and Palliative Medicine at AIIMS, New Delhi. He's super specialized in onco anesthesia and is keenly interested in cancer pain management, palliative care, and onco critical care. He has 50 publications in national international journals and a member of more than 15 medical societies. Now inviting Dr. Ruchika Tandon on the stage. Zordar taaliyan Dr. Ruchika ke liye. Associate Professor in Department of Neurology at SG PGIMS, Lucknow. Ladies and gentlemen, she has authored 31 research publications, including 17 in reputed international journals. Her chief areas of interest are movement disorders, neurocognition, and headaches. She serves as a reviewer for several journals and as a section editor for Movement Disorders section of Neurology, India. बहुत-बहुत बधाई. Inviting Dr. Sheetal Patil on the stage. बहुत-बहुत शुभकामनाएं Dr. Sheetal Patil को. Professor and Academic Director at Venkatesh Chest Hospital, Latur, a 30-bed facility with advanced respiratory care services. With 194 research publications, his work focuses on ILD, CTD, ILD, lung cancer, asthma, etc. Ladies and gentlemen, before we go any further, I have been informed that one of our chief guests, apart from Dr. Rajabhushan, Shri Harsh Malhotra has arrived. Zordar taaliyan Dr. Harsh Malhotra ke liye, Minister of State for Corporate Affairs and Road Transport. बहुत-बहुत स्वागत श्री हर्ष मल्होत्रा, मिनिस्टर ऑफ स्टेट फॉर कॉर्पोरेट अफेयर्स एंड रोड ट्रांसपोर्ट.
नमस्ते नहीं, आपके लिए वेलकम करने के लिए अपनी बात कर लो. हमारे बीच में हमारे अपने एमपी जननायक श्री हर्ष मल्होत्रा जी आ गए हैं. हर्ष जी के लिए थोड़ी देर के लिए मैं आपका इंट्रोड्यूस कर दूं. ईस्ट दिल्ली के जनमानस ने इनको इस बार लाखों वोट से जिताया और इनका इतना प्यार था लोगों के बीच में कि किसी तरह की कोई भी कैंपेन इनके खिलाफ काम नहीं आई. हर्ष जी पहले से एक दधीची एक प्रोग्राम है जिसके अंदर देहदान अंगदान को प्रमोट करते थे और सालों साल से हम इनके साथ एसोसिएटेड रहे इस पर्टिकुलर प्रोग्राम के लिए. और इसके साथ साथ ही इनका इतना प्यार इलाके के था कि हर आदमी इनके साथ एसोसिएट करता है और आज के दिन ही हमारे साथ आए हैं. तो 2 मिनट बोलूँगा सर आपके लिए कि आज का प्रोग्राम जो है, आज का प्रोग्राम, हाँ वही तो आपके लिए प्रोग्राम के लिए बता रहा हूँ. आज का प्रोग्राम हिंदुस्तान के जो मेडिकल रिसर्चर्स हैं, जो मेडिकल रिसर्च में एक्सेल कर रहे हैं, उनके लिए उनको अवार्ड देने का था. और सारे दिन आज के दिन हमने डेलिब्रेट किया, जो एक्सपर्ट्स थे हमारे, कि किस तरह मेडिकल रिसर्च हिंदुस्तान में इसको पॉपुलर किया जाए. साथ ही साथ जो हमारे प्रधानमंत्री का विज़न है, मेक इन इंडिया, मेड इन इंडिया, और किस तरह हम 1935 तक अपने हर साथी को, अपने हर देश के वासी को इंडिजिनस मेडिकल से अफोर्डेबल मेडिकल केयर दे सकें। उसके लिए ज़रूरी है कि मेडिकल रिसर्च की जाए, और मेडिकल रिसर्च करके जो भी कुछ हम सामान बाहर से मंगा रहे हैं वो अपने यहाँ बनाकर उसे सस्ते दाम पे क्रिएट किया जाए। उसके लिए हमारे पास आज बहुत ही डिस्टिंग्विश फैकल्टी थी सर, सन फार्मा, मैनकाइंड फार्मा, जितने भी डिवाइस के सब लोग आए हुए थे, और उन लोगों ने सबने कमिटमेंट किया कि आने वाले दिनों में मेडिकल रिसर्च पे साथ जोड़ देंगे और कोशिश करेंगे कि अपनी हेल्थ केयर का जो एक्सपेंसेस हैं उसको 50% तक ला सकें, और तभी पॉसिबल है तो हम सब चीज़ें यहाँ दिल्ली बनाएं। तो आज का ये जो अवार्ड का सेरेमनी है इस समय सर, ये हम उन लोगों को दे रहे हैं जिन लोग यंग लोग हैं, जिन रिसर्चर हैं और पेपर्स लिख रहे हैं, हमारे देश का नाम बाहर कर रहे हैं। पायनियर रिसर्च है, और अभी तीसरा रिसर्च अवार्ड शुरू हो रहा है, स्टेलर रिसर्च अवार्ड, विच इज गोज़ फॉर द इनोवेटिव रिसर्च। तो उसके लिए नाम अनाउंस कर रहे हैं। इससे पहले मैं हर्ष जी का थोड़ा फ्लावर से स्वागत कर दूँगा।
Dr. Prem Agarwal will now present a beautiful bouquet to one of our chief guests who has joined us here. तो award segment को continue करते हुए, ladies and gentlemen, we have presented 2 categories of awards, and now it's time to begin with the next category, which is the Blackbuck Stellar Research Award. It is given to recognize exceptional research work that demonstrates originality, significance and impact within a medical field which inspires others to pursue excellence in their own. By honoring outstanding research in medicine, these awards encourage further exploration, innovation and collaboration among scientists, clinicians and healthcare professionals' research endeavors. Ladies and gentlemen, please allow me to begin with this set of awards. सबसे पहला नाम Blackbuck Stellar Research Award में जाता है डॉक्टर अमित मोहन। जोरदार तालियां डॉक्टर अमित मोहन के लिए। He is a consultant pediatric ophthalmologist at Sankara Eye Hospital, Jaipur. He specializes in pediatric ophthalmology and strabismus and has over 12 years of experience in children's eye care. Ladies and gentlemen, he's published over 50 research papers in national and international journals and received multiple academic awards as well. Ladies and gentlemen, डॉक्टर अमित मोहन को शुभकामनाएं देते हुए आगे बढ़ते हैं और अब डॉक्टर मनीष साहनी को इनवाइट करते हैं। डॉक्टर मनीष साहनी, congratulations. Consultant in surgical oncology at Venkateshwar Hospital, Delhi. He's published 23 research articles in index journals. He's recognized with national awards including Best Medical Student of 2022 by Indian Medical Association, an outstanding young oncologist of 2023 at Vigyan Bhavan, Delhi. Dr. Sahni completed his post-graduation in surgery from Oswal Cancer Research Institute, Punjab. Ladies and gentlemen, we congratulate Dr. Sahni. Now inviting Dr. Puneet Batra for receiving his award. Dr. Puneet, बहुत-बहुत शुभकामनाएं. Dr. Puneet is the Principal Professor in HOD Orthodontics at Manav Rachna Dental College, Faridabad. Dr. Batra has published over 130 papers in peer-reviewed journals and received numerous awards including the P.P. Jacob and J.G. Kannappan Awards. Many congratulations. बहुत-बहुत शुभकामनाएं. Ladies and gentlemen, we would now be inviting Dr. Srinivas Ramaka to please join us on the dais. Dr. Srinivas के लिए जोरदार तालियां. Consultant cardiologist at Srinivas Heart Center and chairman of Srinivas Heart Foundation. His pioneering work in clinical cardiology, community cardiology, tobacco prevention, and out-of-hospital cardiac arrest has gained global recognition. He has presented research at the World Congress on Cardiology and the American Heart Association, focusing on coronary artery disease, heart disease, cardiac arrest, etc. Ladies and gentlemen, he has over 50 research papers published and received the Outstanding Contribution Cardiology Award in 2021. आइए अब इनवाइट करते हैं डॉक्टर विकास लीलावती जाधव को. बहुत बहुत शुभकामनाएं डॉक्टर विकास जाधव. अभिनंदन. He's a consultant radiologist specializing in gastrointestinal tract ultrasound and diagnostics and therapeutic interventional sonography in Pune. He serves as the program coordinator for the fellowship in gastrointestinal tract radiology at the Dr. D.Y. Patil Institute.
But certain institutions needs a special mention. In fact, the research is creating an environment that the institution is important. So first of the award goes to, of course, our mother institution, ICMR, the medical institution, and the award, taking the award will be Dr. Dharmesh Lal. नाम नहीं लिखा ना आपने, कौन ले रहे हैं? He is a senior scientist at ICMR, and he also is one of our jury. I request Dharmesh Lal ji. ICMR, you know that it is a pioneer organization giving maximum research papers, maximum research. It's the environment of the country which creates ICMR. Now the award goes to Baba Farid University of Health Sciences, and is to take that is coming Dr. Rajiv Sood, the Vice Chancellor of the university. Baba Farid University is a leading university in Faridkot, Punjab. Excels in medical research with 26 years experience, 101,000 national and 975 international publications. Dr. Rajiv Sood needs no introduction. He is there with us all the time, and is leading the medical research in the country through Baba Farid University of Medical Sciences. Then Believers Church Medical College. Next goes to the Believers Church Medical College Hospital. Believers Church Medical College Hospital is in Kerala, excels in medical research with 112 projects undertaken, 245 published, featuring 107 index journals. Notable studies include the pioneer work on iron deficiency anemia. It is not said that only government organizations are doing. The private hospitals are also committed themselves to the high degree of research. Bharat Serum and Vaccine Limited. Nobody can ignore Bharat Serum and Vaccine Limited. It's a leading biopharmaceutical company with a strong focus on research. Bharat Serum Vaccine has undertaken 12 research projects and published 6 of them in index journals, guarding 32 citations. Notable among rhythm study highlighted gaps in RS-negative pregnancy in India. Merrill Life Sciences Private Limited. Merrill Life Sciences Private Limited is one of the leading device researchers with 15 significant research projects, 200 published studies, 200 publication index journal. Dr. Thakkar is representing Merrill Life Sciences Private Limited, contributed enormously to the device development in the country. We cannot forget or ignore PGI Chandigarh. PGI Chandigarh is a leading research institution in the country, excels in pioneering cardiovascular research, with so many research projects undertaken, so many published, countable, in all 50 citations, notable projects, cardiac imaging everywhere. Dr. Yashpal Sharma, the HOD of cardiology from PGI, is the one who is come to take the PGI is our parent organization for research. His research in the hemoglobin is a globally accepted research that treatment with hemoglobin conduct is maximum. Sir Gangaram Hospital. Sir Gangaram Hospital in Delhi is a leader in medical research with 310 projects undertaken, 46 published in 1,250 index journal in 5 years. In fact, it is the National Board of Examinations maximum number of students taking studying there, and taking is the chairman of Gangaram Hospital. Dr. Ajay Swaroop is coming presenting Gangaram Hospital. And next comes, not the least, Sun Pharmaceutical. Sun Pharmaceutical is a leader. Sir, leader in the research in medical sciences, pharmaceutical, and is the leader of all the pharmacies in the country. And Dr. Rajakumar is presenting themselves here, and his contribution to the global healthcare advancement is enormous, and especially in non-communicable diseases. Sunshine Hospital. कौन ले रहा है? Sunshine Hospital. Sunshine Hospital. Come. Sunshine Hospital is a bone and joint institution in leader in orthopedic research and innovation, with 30 research projects undertaken, 106 published, 100 publications in Index Journal. They are robotic assist total knee arthroplasty at other places. So.
Ladies and gentlemen, Scientific Scholar stands as the fastest growing medical publishing beacon in Asia, driven by the vigor and vision of a dynamic young team. With an impressive portfolio, Scientific Scholar currently curates over 80 peer-reviewed journals, drawing contributions from India, Africa, and USA. Esteemed Indian journals find a prestigious home with Scientific Scholar, including the revered Government of India's Annals of the National Academy of Medical Sciences. This eminent journal under the Ministry of Health and Family Welfare stands alongside the distinguished Indian Journal of Medical Research, helmed by the Indian Council of Medical Research. Additionally, the Indian Journal of Dermatology, Venerology, Leprology further cements their illustrious reputation. Moreover, Scientific Scholar proudly disseminates 4 medical journals from prestigious academic stronghold of the All India Institute of Medical Sciences, Delhi. Ladies and gentlemen, embracing innovation, Scientific Scholar supports a variety of publishing models and has pioneered the proprietary peer-reviewed management system, Editorial Assist. This avant-garde system streamlines the publications process, ensuring unparalleled efficiency and quality. Ladies and gentlemen, at the heart of Scientific Scholar lies a mission that is both succinct and profound: share, learn, and improve. Taking the award on behalf of Scientific Scholar is Ms. Krupa Sheth, Director Operations, and Dr. Sunny Datta Gupta, Director Publishing, Scientific Scholar. Ladies and gentlemen, please join hands for Scientific Scholar. Ladies and gentlemen, thank you very much. With this, the award segment is over. और अब हम निवेदन करना चाहेंगे कि हमारे मुख्य अतिथि जो हमारे बीच पहुंचे हैं, Shri Harsh Malhotra, Minister of State for Corporate Affairs and Road Transport, will now present his words of wisdom. He brings a wealth of experience and insight from his extensive service in government, especially in areas impacting both corporate affairs and transportation, which are vital to the infrastructure and health services. Welcoming Shri Harsh Malhotra.
Ministry of State on the dais, and most distinguished guests on the dais and off the dais. जो डिग्निटरीज यहाँ पर मेरे सामने बैठे हैं, मैं समझता हूँ आप लोग जिस फोरम पर मुझे डॉक्टर प्रेम ने यहाँ पर आमंत्रित किया, डॉक्टर चौधरी समझ सकते हैं, डॉक्टर साहब है ना जी आप, मुझे मालूम नहीं है, सॉरी, यू आर ऑल्सो एन डॉक्टर, ठीक है। डॉक्टर साहब समझ सकते हैं कि आप डॉक्टर होते हुए अगर सरकार का काम भी करते हैं तो इनकी व्यस्तता मेरे से भी ज़्यादा होगी, और क्योंकि मैं दिल्ली से सांसद भी हूँ तो इस कारण से सैटरडे संडे सारा दिन कॉन्स्टिट्यूएंसी के लिए होता है और बहुत भागदौड़ होती है। वर्किंग डेज में जब संसद है तो अलग तरह की भागदौड़ है। तो मुझे डॉक्टर प्रेम ने कहा था कि आज हम जो मेडिकल फील्ड में रिसर्च स्कॉलर्स हैं, रिसर्च करते हैं या उनकी मदद करते हैं, उन लोगों के साथ एक लगभग सारा दिन का एक सेमिनार है, उसमें मेरे को आमंत्रित किया हुआ है। मैं आपके बीच में हूँ। मैं समझता हूँ जिस फील्ड में आप लोग काम कर रहे हैं वो फील्ड बहुत महत्वपूर्ण है। जब कोविड जैसी अनप्रेसिडेंटेड, अनएक्सपेक्टेड एक महामारी से भी ऊपर मैं कहूँ पैंडेमिक पूरे विश्व में आया था, तो भारत पूरे विश्व के स्तर पर देखा जाए तो अभी डेवलपिंग कंट्री है, और बाकी जो डेवलप्ड कंट्रीज भी हैं पूरे विश्व में वो भी कोविड से कोप अप करने में सब घबरा रहे थे। लगभग मैं अगर सरल भाषा का उपयोग करूं तो थर थर काँप रहे थे। हम सब ने टीवी पे देखा है, और वो वाकई ऐसा समय था कि मतलब मैं अगर एक शब्द बोलूं कि उस समय का डॉक्टर भगवान से भी बड़ा भगवान था पेशेंट्स के लिए, तो अतिशयोक्ति नहीं हो सकती। मेरी बेटी भी डॉक्टर है और वो फॉर्चुनेटली उस समय दिल्ली में ही एक गवर्नमेंट हॉस्पिटल में जेआरशिप कर रही थी, और क्योंकि उस समय तो आने जाने का साधन भी कोई नहीं था, मैं ही उसे रोज हॉस्पिटल छोड़ने जाता था और रात को लेने आता था। तो मैं उससे पूछता था आज का स्कोर क्या है, तो वो बताती थी आज 25 ब्रॉड डेड केसेस आए। और मेरे पास वो फोटो उसकी आज भी है, जब वो सिर से लेके पैर तक टोटल उस शील्ड में रहती थी। तो मैं समझता था कि उनके साथ और भी डॉक्टर्स थे, मैं उदाहरण सिर्फ अपनी बेटी का दे रहा हूँ कि डॉक्टर्स ने उस समय किन परिस्थितियों में देश को संभाला। वाकई मुझे लगता है 100 साल बाद ये बीमारी आई थी, भगवान ना करे कभी दोबारा आए, पर डॉक्टर्स उस समय भगवान से भी ऊपर भगवान थे, मेरे को ऐसा लगता है। और उस समय आदरणीय प्रधानमंत्री जी ने जिस तरह से देश को लीड किया था इतने बड़े पैंडेमिक के समय में, और 9 महीने में या 10 महीने के अंदर अगर देश के अंदर 2 वैक्सीन्स बना पाए थे, तो वो आपके जैसे जो लोग हैं रिसर्च फील्ड में, उनमें से मैं देख रहा था सीरम इंस्टीट्यूट के भी लोग यहाँ पर थे, तो आप ही के साथियों ने ही देश को बचाने के लिए जो वैक्सीन्स बनाई, वो ठीक है लीडरशिप, ब्यूरोक्रेट्स और पॉलिटिकल लीडरशिप गाइड भी करती है, हौसला भी देती है, लेकिन काम करने वाले लोग तो रिसर्च स्कॉलर्स आपके जैसे ही लोग थे, आप ही लोग थे जिन लोगों ने इतना बड़ा कारनामा पूरे विश्व में गिनती के 4 या 5 कंट्रीज ऐसे थे जिन्होंने उस समय वैक्सीन बनाई, और उसके बाद उसको जो एग्जीक्यूट किया वो प्रधानमंत्री जी की लीडरशिप के अंदर पूरे देश में, उसमें डॉक्टर्स, पैरामेडिक्स, हमारा एडमिनिस्ट्रेटिव स्टाफ्स, एडीएम्स, डीएम्स और बहुत सी सोशल ऑर्गेनाइजेशंस ने मिलके उसको जो 220 करोड़ से ज़्यादा वैक्सीन्स लगीं, और हम पहली डोज लगने के बाद ही, भारतीय तो वैसे ही बहुत निडर होता है, बहुत जल्दी निडर हो गए थे, लेकिन उसके बाद जो सेकेंड वेव आई थी उसमें नुकसान भी बहुत ज़्यादा हुआ, वो ज़्यादा भयावह भी थी। पर आज का जो इनिशिएटिव है अपने उन रिसर्च, मेडिकल फील्ड के उन रिसर्च स्कॉलर्स को जिन्होंने रिसर्च की है या आगे कर रहे हैं, उनको रिकॉग्नाइज करना, उनको अप्रिशिएट करना, ये एक बड़ा अच्छा फोरम भी है। और बिल्कुल मैं समझता हूँ कि अपने आप में एक बड़ी अच्छी पहल है, पहले भी हो सकता है किया हो। डॉक्टर साहब ये पहली बार है? पहली बार है। तो जो ऑर्गेनाइजर्स हैं, मुझे तो डॉक्टर प्रेम ने कहा आने के लिए, डॉक्टर हरीश से भी बात हुई तो मैं आपके बीच में आया हूँ और आप सबको भी बधाई भी देता हूँ जिन लोगों को यहाँ अवार्ड्स दिए हैं। मैं ये मानता हूँ कि ये अवार्ड्स एप्रिसिएशन के लिए तो होते ही हैं, पर एक हौसला भी होता है कि एटलीस्ट वी आर बीइंग रिकॉग्नाइज्ड। ये एक बड़ी बात होती है। हम कई बार बहुत बड़े बड़े काम करते हैं और अपनी सेटिस्फेक्शन के लिए करते हैं। इसमें आप में से अधिकांश लोग ऐसे होंगे जो कुछ भी रिसर्च कर रहे हैं मेडिकल फील्ड में या दूसरे पैरामेडिकल फील्ड्स में, उससे आप लोगों को अपनी सेटिस्फेक्शन ज़्यादा होती है, पर फिर भी कोई समाज का कोई व्यक्ति आकर के अप्रिशिएट करता है तो अच्छा लगता है और हौसला बढ़ता है और आगे और काम करने के लिए भी हिम्मत आती है, प्रेरणा आती है। आप सबको मैं इस बात के लिए बहुत बहुत सभी को बधाई देता हूँ। हो सकता है सभी को तो अवार्ड नहीं मिला होगा, मुझे लगता है बाकी लोगों का कुछ ना कुछ ये तो एप्रिसिएशन रहता ही है कि यू पीपल आर स्टिल डूइंग समथिंग फॉर द कॉज ऑफ द सोसाइटी। ये अपने आप में एक बड़ा अवार्ड होता है। आप सबने यहाँ मुझे बुलाया, सुना और मुझे भी अच्छा लगा आप लोगों के बीच में आकर के, आपसे मिलके। बहुत बहुत धन्यवाद। भारत माता की जय।
अवार्ड सेगमेंट बिना जूरी को सम्मानित किए कभी भी संपन्न नहीं हो सकता, जिन्होंने अपने अथक प्रयास और इतना समय दिया कि अलग अलग अवार्डीज़ को उनके स्टडी कर सकें पेपर्स को और किस प्रकार कौन किसको अवार्ड मिलना चाहिए नहीं मिलना चाहिए। जूरी का बहुत योगदान है। हम यहाँ सम्मानित करना चाहेंगे हमारे जूरी मेंबर्स को और मैं निवेदन करूंगी मंचासीन अतिथियों से कि कृपया हमारी जूरी को प्लीज़ जिनकी रिकग्निशन है उनकी ड्यू रिकग्निशन आप प्रेजेंट करने की कृपा करें। लेडीज एंड जेंटलमैन, we'll take another few minutes and invite the jury members, beginning with Dr. Arun Kumar Agarwal, former Dean Maulana Azad Medical College and President at Delhi Medical Council. जोरदार तालियां डॉक्टर अग्रवाल के लिए। He's been a big support, ladies and gentlemen, jury members के लिए जोरदार तालियां एक बार। इनके बाद हम डॉक्टर यशपाल को आमंत्रित करेंगे। HOD ऑफ कार्डियोलॉजी PGIMR, इनवाइटिंग डॉक्टर यशपाल शर्मा HOD डिपार्टमेंट ऑफ कार्डियोलॉजी। बहुत बहुत आभार। One of our jury members who really helped us decide on the awardees. इनके बाद डॉक्टर अशोक कुमार बग्गा जी को इनवाइट करेंगे, कंसल्टेंट एंड फॉर्मर डेप्यूटी डायरेक्टर जनरल ICMR। बहुत बहुत अभिनंदन और धन्यवाद। Thank you, Dr. Bagga, for all the support, for all the help that you have given to us. Dr. Achal Gulati, Director, Principal and Director Professor of ENT. Ladies and gentlemen, इनके लिए जोरदार तालियां डॉक्टर अचल गुलाटी के लिए। Inviting Dr. Dharmesh Lal, बहुत बहुत अभिनंदन and thank you very much for all the help that has been provided by you. Thank you, Dr. Dharmesh.
सर ने एक क्वेश्चन पूछा कि भाई क्या हिरन लगा दिया तुमने, को मार के तो नहीं लगा दिया। सर ये ब्लैक बक था, मैं रिपीट कर दूं। ब्लैक बक इज ए elite, beautiful animal which needs protection, and so is our researchers. They are distinguished elite people. They need protection and support. so that they can do a wonderful job. So this is only depicting a researcher, young researcher, as a black bug. And these are all, there's nothing, no animal was killed in this formation of this research. Thank you very much, sir.
हम आपका भी आभार व्यक्त करना चाहेंगे, beginning with thanking our chief guest Dr. Rajbhushan Chaudhary, श्री हर्ष मल्होत्रा, जैसे भी दोनों हमारे मुख्य अतिथि महोदय हैं आज. जोरदार तालियां हमारे चीफ गेस्ट के लिए, लेडीज एंड जेंटलमैन. And also we'll be thanking Dr. B. Srinivas and Dr. Abhijat Sheth.
अब आखिरी मोमेंट जो है वो तो सिर्फ धन्यवाद का है. तो मैं धन्यवाद देता हूँ अपने हर्ष जी का, जिन्होंने अपना बहुत ही बिजी शेड्यूल अपना तोड़ के यहाँ जरूर आए. राजभूषण चौधरी जी का, सर धन्यवाद ले लो, सर धन्यवाद ले लो बस. चौधरी साहब का पटना से फ्लाई करके आ रहे हैं, 100 to 8 2 बजे यहाँ आ जाएं. अपने शेठ साहब का प्लीज़ गिव ए क्लैप. शेठ साहब का ये भी कॉम्प्यूटर से फ्लाई करके आ रहे हैं, ऐसा फ्लाई किया कि 2 बजे से पहुँचेंगे. श्रीनिवास का हमारे एनएमसी का सेक्रेटरी है और सबको ऑल सपोर्टिव है. एंड अपने साइंटिफिक स्कॉलर के सेठ साहब का. लेकिन मेरा कहना यह है कि आज का प्रोग्राम जो है, चाहे छोटा है चाहे डिस्टिंग्विश्ड लोग हैं, वो लोग हैं जिन्होंने पॉलिसी बनानी है, जिन्होंने पुश करना है. आई विश द मेडिकल रिसर्च इन आवर कंट्री टेक्स ए पुश टुडे. एंड गवर्नमेंट भी है, सरकार भी है, प्राइवेट सेक्टर भी है, और मिलजुल के हम अगर कोशिश करेंगे तो ज़रूरी है कि हमारे प्राइम मिनिस्टर का जो विज़न है, जो एम्बिशन है, वो 2035 तक हम लोग हेल्थ केयर के मामले में सेल्फ सफिशिएंट हो जाएं, ऐसा अचीव कर पाएंगे. धन्यवाद सबका. और सबसे ज़्यादा धन्यवाद मेरा अपना जूरी का, जिन्होंने मुझे बहुत हेल्प करी. बहुत धन्यवाद मुझे उन रिसर्चर्स का जिन्होंने अप्लाई किया, और आप सबका जिन्होंने बात आज की, फैकल्टी ने जिन्होंने डिसाइड किया. धन्यवाद हरीश जी का, धन्यवाद मनोज जी का, धन्यवाद आप सबका बार बार धन्यवाद. We'll meet again next year in the same award ceremony. Thank you very, very much. Join for a cup of tea, huh? Please.
Thank you very much, ladies and gentlemen. With this, we conclude the Blackbuck Awards. और जैसा कि हमने सुना कि Blackbuck distinguished है और उसे संरक्षण की भी आवश्यकता है, तो दोनों ही बातें साथ साथ चलती हैं. सभी को शुभकामनाएं. जितने भी एमिनेंट रिसर्चर्स को यहाँ पर सम्मानित किया गया है, we and pray that this good work continues. Ladies and gentlemen, with this we conclude. Congratulations, and now requesting everyone to please join us for a cup of tea. Thank you very much.